Morning, everyone. Before we start, if we could please rise and join me in a pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. At this point, I'm opening the full committee work session to deal with HB 287 and HB 470. And Representative Muse, would you like to talk to us for a few seconds here about this?
Sure thing. These are two bills that earlier on the schedule we decided to hold off on execing, and one of the things that has done is it has given us some time to basically put together some information that compares and contrasts two bills that I think essentially try to achieve the same aims. One of the things that we're trying to do right now in New Hampshire is to catch up to where some other states are in terms of our ability to legally offer drug checking. And why drug checking is important is because of the amount of fentanyl that's being found in pills that are actually being sold on the street. Any more fentanyl is being used to cut other drugs because it's cheaper than those drugs. It's more available than those drugs. And I think one of the things we're finding out in New Hampshire is it's also far more deadly than those drugs. So I think our choice today, hopefully, we kind of go in one of two directions, but basically go in the same general direction of catching up. But I think the ultimate goal here of both of these bills is to reduce the number of deaths due to overdose in this state. We have a real issue. My personal opinion is that one of the bills will go farther and will help us do that, and will help us save more lives. The other bill would be a good start, but one of the things that I would ask you to sort of keep in the back of your mind as you look at both of these bills is the severity of the problem that we have now. So not too long ago, I read in the news that 5 people died of overdoses in a single week in Manchester alone. So we have a real problem, and well, I'll be the first to admit that we absolutely need to put resources into law enforcement and border interdiction and stopping the flow of drugs into New Hampshire. What it doesn't do is change the fact that there are already a lot of drugs that are already in New Hampshire and are killing people. And so I'd like to think that this isn't a choice between one approach or the other, that essentially the basic approach of reducing the harm that the drugs that are already in our state can do is something that we can adopt as a strategy to complement the sort of tighter enforcement I think that everybody wants to see. So essentially, that's what HB 470 as amended would do. To a lesser extent, what 287 would do is offer some protection to people, legal protection to people who are using and providing fentanyl test strips now, which are basically currently considered illegal drug paraphernalia. In terms of what it might accomplish, one of the things that we learned during the public hearing is we learned that the test strips are already being distributed in New Hampshire. They're not, I wouldn't say that they're widely available, but they're available in some of the places where they actually will do good. So, an issue is how far do we actually want to go with this? Do we want to catch up a little bit or do we want to lay the groundwork for actually being able to do, to expand this type of work? And one of the reasons why this is necessary is we're also seeing things like xylazine being cut into drugs on the street. And uh, while xylazine doesn't create the same kind of overdose problems at the same level that cutting pills with fentanyl does, it creates a whole other set of problems in terms of the way that it reacts with some of the drugs that it's combined with, and also just the physical toll that it takes on the people who use it. Um, I'm not an expert in pharmacology, but it looks like using xylazine can create some of the same physical effects that we see with people who are on meth. Um, open sores, open sores that get infected. Um, it's basically a terrible thing for anybody to have to go through. Um, so I think one of the things we're trying to do is to, with this approach, is to modify our Controlled Drug Act in a way that makes it possible for us not only to provide things like fentanyl test strips, but to provide more widespread, the more widespread capability for people uh, who are using, who are using drugs, and yes, they are illegal drugs, but for people who are using these drugs to actually know what they're taking. And I think one of the things that I said during the public hearing that I'll uh, that I'll repeat now is, if it was your kid, what would you want? Would you want us to be? Would you want them? I mean, you're never going to want them to take drugs, but if they are taking drugs, if they're thinking about taking drugs, wouldn't you want to know that there's a place you can go or they could go, uh, just to make sure that what they're taking is really what they think they're taking, and and also what they to know that what they might take, while not actually being, quote unquote safe, at least won't kill them. Uh, so I think those are the things that we're trying to accomplish today. One of the things that I've done is I've uh, in conjunction with some of the folks who are here, Ms. Nolte, Ms. McGinley, put together a comparison sheet between the two bills. There is an amendment to 470 that I'm prepared to walk through, but for now, I'm going to stop talking and let other people weigh in. Thank you.
Actually, before you stop talking, could you just tell us the change you made in the amendment? The concern that we heard was regarding the packaging materials for controlled substances, and it looks like you've done something with it. I'm just not sure.
Yeah, the concern around packaging materials, we have attempted to address that in the amendment. So in the original bill, I think the way that folks were interpreting it is that any packaging materials would no longer, be subject, for instance, if you're found with packaging materials, during an investigation, those actually couldn't be used in the prosecution. Um, and so the issue with that, I think, from a law enforcement point of view, is you want to make sure that people who are creating factories or who are distributing drugs, that materials like that can actually be used as evidence in the prosecution against them. Um, what we're trying to do with the amendment is to sort of separate that kind of packaging from essentially what people would need to bring in a small amount of drugs to get tested. So the little baggie that I use, the little sandwich bag that I use to bring in half of a pill, or a small amount of drugs, um, we we don't necessarily want people charged with violating the drug paraphernalia law, if for simply using that to package the material that they want to have tested. So I think that's the distinction that we're making. Another thing that we've done with the amendment, we've added, there's a provision in there that when we're defining drug checking, we're also expanding expanding it to cover not only naloxone, which is the opioid reversal agent that's currently the most in use with fentanyl overdoses, as well as any kind of opioid overdoses, and just broadening it to include all opioid reversal agents. And one of the reasons we're doing that is because the FDA has actually begun to approve some new opioid reversal agents that will be more effective on fentanyl. So, in a state where we're so often trying to catch up, one of the things that we're trying to do is catch up a little more, if not start to get a little bit ahead of the game, or at least put ourselves into a position where every time we do something like this, we don't have to start from scratch, and to do things like add things like fentanyl test strips one bill at a time.
Representative, thank you. I'm looking at the amendment, and it says, I'm confused, and it may be just me, but paragraph XA says drug paraphernalia will include packaging, repackaging, storing, but then the addition underneath says it shall not include drug packaging, preparing. So how does that address the law enforcement concern?
I think what, if you look down at XD, if you look at the last line in XD, what it says is drug packaging in this section refers to packaging materials provided for or utilized in drug checking.
Okay. Thank you. Anyone else now? Representative Mannion?
Thank you, Mr. Chairman. I'm looking at the section that says containing nominal amounts for the purpose of checking, the definition being 10 milligrams or less. Does this bill make possessing 10 milligrams or less of any drug now legal?
No.
That's how I'm reading it. So
Would
you
it-
could help me out with that.
What it does is it considers 10 milligrams or less when it is brought in for drug checking. What it does is make it allowable for drug checking. It doesn't make the drug legal, but if it's being brought in for drug checking purposes, a nominal, and essentially the reason that's in there is people have to bring in something. And given the nature of the beast, anything that they bring in is going to be illegal. So I mean, it's a little bit of a conundrum, and this is an area where we do need to have a little bit of flexibility if we're going to save lives.
Mannion?
Thank you, Mr. Chairman. Just as a follow-up, so if people who use drugs package it all in 10 milligram increments, and anytime they get stopped, they can say they're on the way to get it tested, would that pose a problem? Would that make it legal?
I think so I'm not sure I understand the premise of your question, but
Wait a minute. I think what he's saying is, if I'm a drug dealer and I want to circumvent the law, can I then just package everything in 10 milligram packages? And if I get stopped, say I'm just going to have it checked at the place, would this law let me on?
So kind of following that through, if you have 10 milligrams and it's in the type of packaging that somebody would normally use, the average person would use to actually transport a small amount of drugs to a drug testing facility, yes. Somebody could say that. On the other hand, what they wouldn't be able to do is to create a whole bunch of little tiny packages with less than 10 milligrams, and if you stop them, they wouldn't be able to say, oh, I only have a whole bunch of little tiny packages, and I'm on my way to drug checking. I mean, this is, we're not. I think part of what we're trying to do here is we're trying to help people who otherwise might die from taking drugs that basically have bad stuff in them. We're not trying to get in the way of criminal prosecutions at all. But I think these are some of the judgment calls that we have to be willing to make if we're gonna save more lives in this state.
I agree. I think that when we look at these, we also have to play devil's advocate to make sure that we don't leave a big hole. But I see where you're going. Who had a hand up? Representative Bolden?
I've been here 120 seconds and I want to talk. I just had a question for Representative Mannion because, or maybe any of the other people with law enforcement experience in the room. I know that there's some inferences, or at least as far as I know, there's some inferences that you have to make to decide between the charge of possession or versus possession with intent to distribute. Do I have that right? And I was thinking that maybe if you can speak to the reasoning between one of those charges or the other, that might highlight how this would be implemented or like shed some light on it.
Yes, clearly you need more to prove dealing as opposed to just possessing. However, my question goes both ways. If I'm a drug user and I know that 10 milligrams or less is legal, that's all I'm going to carry on me at any given time, or that's how I'm going to package it. And I'm not talking just specifically dealers. This applies to anything. So if you're a drug user and you want to skirt the system, you just package everything in 10 milligrams or less, and now it's legal to possess. That's my concern.
Well, that's what I'm trying to understand. I'm not asking this question to be argumentative, but to understand, because I've never had to personally decide between charging someone with possession versus possession with intent to distribute. But it is possible, from what I understand, for someone to have a substantial volume of illegal drugs that they don't intend to distribute. And then there's whatever factors are observed by the officer that seem to justify the charge of possession with intent to distribute. And so I wonder, if someone had a whole bunch of 10 milligram packages, why couldn't they be charged with intent to distribute in that case? You know, regardless of whatever the law says. So that's what I'm trying to wrap my head around, is like, when does an officer decide
Yeah, that
intent to distribute?
that is one of the elements that would go towards intent to distribute: packaging material, the amount of the drug, if the drug's prepackaged, a lot of money. There's a lot of different things that would add up to an intent to distribute. Having a lot of packages would be one of the elements.
Well, that's what I mean is,
Yeah.
why couldn't that be a charge in such a scenario if someone had a whole bunch of 10 milligram or whatever packages? What's the limitation? I'm guessing, like, that's what I guess I'm trying to get at, is like, what would prevent an officer from charging someone with intent to distribute in that situation? Wouldn't there be enough?
It will
There?
be enough. In my experience, let's say they had 5 bags, each one of them was 10 milligrams or less. That certainly would not be enough to charge them with possession with intent to distribute. Well, you could probably charge them, but you wouldn't get a conviction. You would need other things. You might need some history. You might need, as the chairman said, a lot of money in his possession, maybe some scales for weighing stuff, extra packaging equipment on the side. You have to have quite a bit to prove intent to distribute. I just think if somebody packages up 4 or 5 10 milligram bags and they're in their purse, that's certainly not going to be enough to charge with intent to distribute, in my experience.
Representative Manning, what do you think, though, about the last part of the sentence that says containing normal amounts for the purpose of drug checking? I think that it would be difficult to make the argument if you had 3 or 4 bags that was just for drug checking, don't you think? Clarity.
I guess I'm not in support of legalizing any amount of it. I mean, if you're gonna test it, I mean, aren't these testing strips something that a person could get? I thought that was the point of these fentanyl tested strips, or if there's any new drugs coming along, is the person could get the test strips and test it on their own, not have to bring it somewhere to test it. I just see it opening up a door to people now being creative with their packaging to get around drug possession charges.
Representative Rhodes.
Thank you, Mr. Chairman. I don't know if this question is necessary for Representative Muse or if it's for Representative Mannion. The concern that I have with this, which I have always had, is there's two sides to every coin, right? So if you're a drug dealer and your intention is to sell fentanyl, would this just not make it a lot easier to be able to show that indeed there is the drug that you're looking for in this? So how do you combat that? Because everybody is very creative, right? That is the concern that I have. So Representative Mannion kind of brought it up, and I think I would have to have that a little bit more addressed.
What a test strip would do is it would show that fentanyl is in whatever you're testing. What it wouldn't show is the purity of the drug, and it wouldn't show things like xylazine. It wouldn't show sometimes antidepressants or stimulants or other things that can be mixed in a pill, right? So if you're a dealer, trying to prove, let's say that, this is the good stuff. I mean, all a test strip will do is show you that there's a little bit of fentanyl in it. It'll be positive. It's kind of like a pregnancy test strip where you can, you're 100% pregnant, you know.
So Representative Muse, I think that I think you are saying exactly what my concern is that if you are selling it, this is going to show you that you are indeed selling what you say you're selling.
Well, and actually, if you kind of think that through a little bit too, I mean, one of the issues we have is that people don't know they're buying drugs with fentanyl in them. So if a dealer actually was to test it, I mean, a big part of the issue is people just don't know what they're taking, and that's one of the reasons why we're having so many issues with overdosing right now. So I won't say that, I wouldn't say that there isn't any conceivable way that parts of this process could conceivably help a drug dealer a little tiny bit. But there has been a lot of effort behind this bill to make sure that what we're actually doing is maximizing the harm that these drugs can do on people who don't understand what they're taking. That's the real focus of it.
Thank you. I'd like to, at this point, I was wondering, I see there's a representative from the Chiefs of Police Association here. Would you care to weigh in on this, Chief? Based on what you've heard so far? Yeah, sure. Go ahead, Amanda.
What was the reasoning, or what was the basis for the 10 milligram number anyway?
And I think I'll let Ms. Nolte answer that question.
And I'm going to ask them to come up after the chief talks. So
Okay.
Sure.
I think I actually know it, but I just want to make sure I have it 100% right. Thank you.
Thank you, Mr. Chairman. I just want to clarify, I'm in support of the testing equipment to test these drugs, and I want to make sure that everyone knows that. I just don't want to reach a point where we legalize any amount of drugs that people become creative with, and now possession becomes an issue even. Not even dealing, just possession alone. But I am in support of testing, or the ability to test these things.
Go ahead, Chief. Thank you.
Yes, good morning, members of the committee, and Mr. Chair, thank you for giving me an opportunity to address some of these issues. My name is John Brafonsky. I'm the chief in Bedford, and I am the president of the Police Association. The Chiefs Association and law enforcement is not opposed to fentanyl test strips or testing equipment, as the representative just indicated. We're not in opposition to a fentanyl test strip or any material that would determine whether or not there is illicit or even licit drugs in a particular amount of drugs. But we are opposed to any provision that would effectively legalize the possession of any quantity of controlled drugs that results in the death of individuals. For those who may not be familiar with fentanyl, right? Fentanyl, 2 micrograms, not milligrams, micrograms of fentanyl, which would sit on the top of Lincoln's head on a penny, is enough to kill someone. So we're definitely and adamantly opposed to any legislation that would legalize the possession of drugs of any quantity that is lethal and can kill people. But we're not opposed to test strips or other material that would allow someone to determine whether or not a particular quantity of a substance contains a particular drug in it. That seems perfectly reasonable. And your colleagues across the way have a complementary bill that does that, but it does not include the drugs that are being tested themselves. The notion that people are going to travel to a particular location, unless there is something that people are thinking about in terms of setting up a storefront to test drugs, which I haven't heard of yet. It seems to me that people would be getting test strips, and if they had the notion to test whatever they had, they would do that wherever they were. And let me also add that in talking to people that are substance abusers and users that have substance abuse disorders that I've talked to over 44 years of law enforcement, 27 in drug law enforcement, some will tell you, not all, some will tell you that they're actively seeking drugs with fentanyl in it for the particular purpose for why that drug is in it. It gives them a more euphoric reaction than other drugs. And honestly, I don't want to, and I don't hope that the committee is not being misled that drug checking or fentanyl test strips will have a perceptible change in the drug death rate in the state of New Hampshire. 473 last year, and we're on trajectory to increase that this year. Law enforcement desperately wants to reduce that number to zero, if at all possible. There's been a lot of money in treatment and recovery, which is where it should be. And there's more opportunities for treatment and recovery than we've ever had in the state, which is a good thing. But we're swimming in a sea of illegal drugs here in the state, and people will use those if they're available. And we desperately need some additional coordination and support to be able to reduce the supply of drugs that are killing more than 470 Granite Staters every year. That's appalling to me as a police chief and a law enforcement professional, and we are desperately trying to find a way to reduce that. We're not opposed to drug checking, but please do not add the checking amount of drugs that effectively makes it legal.
Thank you, Chief. If there were, because it's my understanding that there are some places, or there will be some places where people could go and have their stuff checked. If that were the case, how would we address the people going to have their stuff tested? Would there any change to this? I know that using a word such as residual versus nominal, would any of that help, you think, or just leave it alone as far as illegality?
In a practical sense, a law enforcement officer is not going to be able to determine someone that's taking a quantity, a testable amount of drugs, and there needs to be a testable amount, right, to a facility, because clearly, as you indicated, they're going to say, "Oh, well, I'm going to the drug checking facility," right? The same issue occurs with the drug take-back boxes, right? There were various iterations of take-back bill that would allow someone to bring illicit drugs to a take-back box. Well, right, I get stopped by a trooper and I have a kilo of heroin with me with fentanyl in it. Well, I'm going to take it to the drop box facility, right? How are you going to disprove that? You can't in a practical sense. So you've created a defensible argument to possession of illicit drugs.
Do you still have a question? No. Representative Janvrin.
Thank you, Mr. Chairman. Thank you, Chief. A few questions, if I may. A police officer in the field, I remember, I'm going back to the 1990s when I was actively involved in that profession, come upon a scene and they find a substance, and obviously you don't want to be touching it as a police officer, rubber gloves, the whole thing, PPE. How do you test in the field whether there are illicit drugs present, and what drugs can you presently test for?
Well, it's been a while since I've done that, Mr. Representative. So I'll tell you that the most recent technology, right, which we don't have, DEA has it, and they do make it available to state police and local municipal. It's a sort of a device that allows the operator to analyze the substance without actually touching it, right? I haven't used it, so I'm not exactly sure how that works. Test strips are particularly dicey when it comes to fentanyl because if it becomes airborne in any kind of quantity, if it happens to be at a very high potency rate, it can induce an overdose. And of course, you know, we're all aware of law enforcement officers and other folks that have been treated at hospitals after succumbing to an overdose when a quantity of a material gets airborne, right? And it's absorbable. Testing is usually done by strips or placing a quantity in a tiny little plastic bag, mixing it with a reagent or reagents in that bag, and then observing the color of the liquid that's in the bag that determines whether or not that particular substance for methamphetamine and other types of drugs, including heroin and whatnot. That's been the most common practice over the years, but there is new technology out there that can do it. It's expensive, I understand.
And Chief, just for the clarity of the committee, a positive test on the test kit was that probable cause to arrest at that point?
It gives you a presumptive indication that there's a presence of illicit drugs, right? And then the sample or the quantity would then have to be sent to the state forensic lab to be subject to a higher level of tests with a gas chromatographer, big machine, to test it to make sure that it does in fact contain that substance.
Representative Newman.
Thank you, Mr. Chair, and thank you for taking my question. So if someone has a pill that they don't know what's in it, and they bring a portion that has 10 milligrams in it to wherever, or they get stopped, or it is tested with the method you indicated, it would tell you there could be any number of illicit drugs. There a limit? How much can it tell you about that other than there's an illicit drug in it, and how does it know?
Right. A fentanyl test strip could only tell you that there is a detectable quantity of fentanyl in whatever substance you're exposing that strip to, right? It wouldn't tell you whether or not there's a lethal dose or a less than lethal dose involved. It's not the perfect answer or solution, simply because most of the samples, from what I understand from talking to the folks at DEA and state police, for the last couple of years, unfortunately, most of the samples that are obtained through investigations or seized contain fentanyl, right? So virtually most of the substances out there contain a detectable amount of fentanyl. Xylazine is more troubling. As you may know, it's a sedative that's used by large animal vets typically. It's in Schedule 3 of the Controlled Substances Act, and it is not an opioid. So therefore, an opioid agonist like naloxone has no effect on xylazine, right? And I'm not aware, and I don't think that there is any manufactured or available testing material that would allow someone in the field to test for xylazine, right? So, and the other question that we're struggling to get an answer to, frankly, is what is the source of the xylazine that is now showing up in a fairly sizable number of seizures in New Hampshire? Is it being illicitly produced in clandestine labs like fentanyl? Is it being diverted from the legal market? Or is it a combination of the two? So we're still struggling to try to get the answer to that. The assumption is that the xylazine that we're seeing is being clandestinely manufactured.
Follow up? So you've answered the question in reference to test strips. I was also interested in the type of testing you described that a police officer would do with a small substance in a particular reagent and it would indicate that there were illegal drugs. Is that the same type of answer?
It's the presumptive amount, right? So if there is if there is a sufficient quantity of drugs to be able to expose it to a reagent, and you need a bit, right? And put it in a plastic bag and mix it with the reagent, that gives you the presumptive indication, presumptively, right? That testable substance contains whatever you're testing it against, right? Whether it's methamphetamine, heroin, or whatever the other case may be.
Thank you.
Representative Stone.
Thank you, Mr. Chair, and thank you, Chief, for taking my question. Based on your training and experience, have you ever found any drug dealers that are really concerned with the end users of their product?
Unfortunately, there are. You know, at the lower level of the drug trafficking spectrum, a number of people support their drug use by selling smaller quantities of drugs. So the answer to that is yes. Typically, traffickers at the higher level of the spectrum don't, simply because they know that if they become their own best customer, they're likely not to survive or make the best business judgments with respect to drug trafficking. So folks at the higher end of the trafficking spectrum typically don't use, but at middle and low ends of the traffic, I found that a fairly sizable number of people support their habits and substance use disorder by selling it to friends and acquaintances or on the street.
Thank you, Chief.
Representative Newell.
So I just wanted to clarify, first of all, that 10 milligrams is about the size of a half a grain of rice. Am I right? It's a very, very, very small amount. To carry around small bags of 10 milligrams in each one is just an interesting thought. But the question that I wanted to ask was, you know, the benefit of, you know, as we've said, fentanyl test strips just tell you whether or not it's in it. It's yes or no. Whereas the other analyzing equipment would be able to give you kind of a breakdown of what's in it, right? And you know, as one of my colleagues said, you know, there's two sides. You can kind of look at it from either side. And I think I'm curious if you think that that would be helpful in the overall fight against, you know, to reduce the harm on people and really to get a handle on these things, for us to know how much of what there is, and then to also be able to get like an early heads up of what new things are coming, especially with the prevalence of xylazine now. Very, very difficult thing to handle. But don't you think that knowledge is power? That would be really good for us to be able to fight back against it?
Thank you for your question. Well, it's a philosophical argument, right? And it's a philosophical decision because what you're proposing or what you're postulating is a strategy that bumps up against facilitating drug use, right? And that's the philosophical question that we all struggle with, right? What can we do to control and reduce? Because if the premise is, right, if the premise is that we don't want people using illicit drugs that causes harm to them and the community, right, then we don't want to engage in any sort of legal exercise that ends up facilitating drug use, which we don't want people to do from the foundational perspective, right? So that's the struggle that we have. And so in a society that we have today where we're effectively swimming in a sea of illicit drugs, right? How, in fact, do we engage in that kind of activity without effectively legalizing possession of controlled drugs? So that's really the problem.
Right. Can I follow up really quickly? I think, you know, just since you brought up kind of what is the premise, right? What do we really want to accomplish? I would just put that a little bit differently. I would say the premise is that we don't want people to die. And I think that, you know, something like this that's really at the heart of harm reduction is, you know, to say that, you know, people may fall down that that go down that road. And it's unfortunate, and we don't want to encourage it or facilitate it. But at the end of the day, we want to keep people alive long enough for them to be able to have the chance to get out of that if they can. So thank you.
You're welcome.
Representative Bolden.
Thank you. I think it was like 2015 that the House passed and the governor signed legislation to give immunity from arrest if the evidence for possession of a controlled substance was found when an overdose was reported. I think it's called the 911 immunity law. And so I know that's like a complicated way of describing it, but you know, if you have drugs on you and you're pulled over, then you're charged with possession. But if you have drugs on you and the only reason that that's come to the awareness of an officer is because you're at the scene of an overdose that you reported, then under the law in New Hampshire, you're immune from prosecution. So my question was, in the time period since 2015, have you seen examples of drug dealers maybe deliberately causing overdoses so that they could obtain that immunity? Because I remember that was an argument against the legislation at the time, and sort of was something that people were worried about, that people would find a way to take advantage of the law as it was proposed. So I wasn't sure if maybe you knew of any instances in which drug dealers were causing overdoses and calling them in to get immunity.
Drug dealers, of course, I can't hope to speculate what goes through the mind of a drug dealer, and I hope I never could or will. But I don't believe that in any right world that they would induce or think about causing a drug overdose simply to escape prosecution by way of the 911 immunity provision, which, by the way, ladies and gentlemen, has not worked out well, has it? Right? When we're looking at the highest number of drug overdoses since we began taking stats in 2015. So the fact that we're immunizing people because they call 911 really isn't working out well. I'm not saying that we should reverse that, but I think we should take a look at what we have done and what is working and what is not working.
No, actually, I think we've gone far enough afield away from the test strips. Do you want to ask a question about test strips? No. Okay.
Just
Thank you, Chief.
Was hoping for the data that he cited, because I think we all get emails with the overdose statistics, and I was hoping maybe you could share whatever you have.
If you have it, yeah.
What's the
She's asking if you have the data as far as the overdoses so far this year. Oh.
Yeah, I do have those. I can tell you that last year, of course, all the toxicology reports have not been completed for 2022. But if all those toxicology reports come back positive for controlled drugs, the number is currently, I believe, at 473, which...
I'm sorry, I don't want to take up any more time. I'm just saying, after the meeting, if you could share
Oh, sure.
the
Yeah.
source for the claim that the rates are higher than in 2015.
Sure, the Office of the Medical Examiner has those as well, so I can certainly get those to you.
Thank you very much. Representative Reed.
Thank you, Mr. Chairman. So I'm bringing this back to the test strips, and the way I think we've, really veered off. So this bill is about legal, making drug checking equipment okay. So if a user's going to go and buy drugs, the way I see it is this could save a life. So they go, they buy their drug, they take it wherever they're going to use, they test it, they use the drug. This back and forth over 10 milligram amounts and packaging it and going it, I don't think any drug user is going to package their drug, go get it tested, go back, that's just not real life. I think we need to bring this back to legalizing fentanyl test strips to save lives. And if you have an amount of illegal substance in your car, then you treat it like it is an illegal substance. But if you're pulled over and you have fentanyl test strips or whatever drug checking equipment, that's fine, But to make it okay to drive around Manchester with little baggies of drugs saying you're getting tested doesn't make sense to me.
Is there a question, Representative Reed?
am I right, I guess,
Oh.
is what, is that what, is that, you know, does that make sense?
It does make sense. I'll go back to my initial statement, which is we're not opposed to fentanyl test strips.
Right.
We're not opposed to the notion of it, right? And I think that your analysis is spot on. That folks are not going to be getting in the car and go, well, let me drive down to the local test strip location and test this out. No, they're not going to do that. They're going to do it at home or wherever they are. So I think that the best way to get this through and make it workable is to remove the provision that contains any kind of controlled substance quantity and simply legalize test strips for the purpose that you intend it to be used for.
Thank you very much.
Representative Murray.
Thank you, Mr. Chair. I think the fact is that there are or will be drug testing facilities, though. So would it be amenable to maybe add in a clarification that while in the process of being tested at a drug testing facility, that amount is that amount is legal? Because I think otherwise you kind of set up a situation where there could just be people go to get their drugs tested and then police just come and arrest everybody.
Right. I don't know. I mean, if there's any sort of speculation that you're going to establish drug testing facilities, I think that we would all have to look very carefully at how that would actually play out in the field, right? And what quantities are we talking about? And there's just a whole range of issues. I think that the start would be to simply legalize the testing, the test strips that you're trying to legalize. And make that something that people can have and use. And then if you want to address this testing facility issue, then come back at it later on and take a look at something that's workable.
Okay, thank you, Chief. We appreciate your time. I'm going to ask now someone who has something to do with the testing facilities, if you'd like to. Yeah, absolutely.
Is it on? Red is on.
Sorry, thank you for, I'm Dr. Carrie Nolte. I'm a family nurse practitioner and a nursing professor and harm reduction researcher at the University of New Hampshire.
I'm Lauren McGinley. I'm the executive director of the New Hampshire Harm Reduction Coalition.
So the first thing that I thought that Representative Bolden's bag would be helpful to illustrate is that there are two different, measures. When we think about milligrams as far as potency, so you can have a large pill that is a 10 milligram pill. It could be like a horse pill. But you could also have a 10 milligram pill that's super tiny. And so that is not what we're talking about. What we're talking about is a weight-based measure. And so in a baggie, we're really talking about like this little corner is 10 milligrams. And to just respectfully correct something that Chief Brofonsky said, my apologies, he had cited that the head of Lincoln's head was 2 micrograms, but the DEA actually uses that same for 10 milligrams. So I just want to translate that. We're not talking about the potency, we're talking about a weight-based measure. So 10 milligrams does represent Lincoln's head
On a penny.
on a penny. Thank you. I couldn't remember the coin. And so I hope that that's helpful. I think I'm so happy to hear that the committee sounds supportive of the test strips, which is great. In reality, that's not a positive change for our state right now. Fentanyl test strips are already distributed through harm reduction programs. They're covered under the syringe service program, so any member of a syringe service program can possess them. Within public health, we always think about a Swiss cheese model of we're never going to do all the things. There's no one solution. So we've brought in Good Samaritan laws. We've brought in naloxone. We've brought in harm reduction programming. Fentanyl test strips is another one, but comprehensive drug checking is another one. And so clearly the discussion that you're having is whether to bring in comprehensive drug checking today. And so within that, we know now since we have talked to you previously, there's already a new synthetic opioid out, nitazene, apologies for the pronunciation. I've only read it and not actually spoken it. But we know that that is circulating in the drug supply in the mid-Atlantic states and Maryland in particular. And the only way we know that is because they have comprehensive drug checking in those places. And so what we want to be able to do is that, to be on the forefront of these things. And so as we think about the drug deaths being as high as they are and having increased, last year being the highest year, it's not about a policy that didn't work. It's that our policies are working. It's that we may have seen 1,500 deaths last year if not for all these slices of cheese that we've put in place over the last 5 years. And so within that time, as far as I'm aware, and looking at the medical examiner reports, there hasn't been a heroin death in the state of New Hampshire in 5 years. They're all fentanyl deaths. And so when we think about talking about fentanyl, it's ubiquitous. It is the drug supply. It's not just something that's there. And so, you know, recently there's been anecdotal reports that are unverified, but of people using fentanyl test strips on Adderall at a private school and those testing positive. And so when we talk about all of these, we have to make sure that we can do that and offer those services. The comprehensive drug checking is a proven strategy in Massachusetts, California, Rhode Island, where they have seen reductions in deaths. And part of that is not just the testing itself, but the messaging. So we would be able to message out to people who engage with treatment programs and harm reduction programs. There's carfentanil circulating in the supply. Use extra caution. And those messaging. So it only takes one test to identify a new substance instead of a year of waiting to find out what it is. I would just like to point out one other thing that came up that was a minor modification. So based on the prior discussion, we had talked to some other drug checking experts across the country to support Representative Muse's amendment here. And under 3XD, drug packaging means the materials or items used by persons ingesting drugs. So specifically there, we took out selling or buying to clarify that that was not the intention, that to support drug traffickers testing supplies. Within that, you know, within those conversations, where the nominal amount came from and where that was added was the concern over what you're talking about today. Can people say, I'm bringing this for drug checking and not be, you know, I'm going to tell you for sure that drug dealers are not going to package this little corner of drugs into little plastic baggies based on this. It's just not feasible. It's not going to happen in my work with people who use drugs. And so where nominal amount came from was actually legislation in other states. So if the committee would like to move to residual, I see no problem with that. I think we see no problem with that. But what had happened in other states was that people were concerned about the definition of residual. And so nominal is actually meant to imply that residual amount, that little tiny piece. Now, the other changes in here, including moving all of the terminology. So the original bill asked to eliminate preparing, packaging, repackaging, blah, 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 completely. And loud and clear, that was heard. That wasn't feasible. That may interfere with probable cause. But here we are specifying that this is for, you know, drug checking. So the mechanism of it would be that as the chief had spoken about, I think it's what he was describing is the same units that we're looking to use, that police have used for a public health use. And so within that, you know, you can do a test that says this has xylazine, fentanyl, methamphetamine, etc. on the spot. You can tell people what is in there. You can say, yes, this Adderall has fentanyl in it. But you need to send it out in order to quantify it. And so that's why in order to be protected, in order to do this work, we need to have preparing, packaging, repackaging, all of that. Not because we want to eliminate packaging from a probable cause, but because we as public health practitioners need to be able to do that for this program to be effective. Sorry. Thank you for all your time. I'll defer.
No, actually, that
Oh,
you raised a couple questions. So, if the bill said packaging materials for use by the testing facility versus just leaving it blank, would that not narrow it down so that only you would be the ones?
I think that would be reasonable. It's just that the nominal amount definition is under drug checking
Right.
already. So that to me clarifies the purpose. I mean, I guess the only other thing, and I say this as a researcher, would be that, you know, I have a goal of doing research on wounds and drug checking. And so, you know, I might not be a testing facility, but, you know, it's part of that research and where we can see and quantify what xylazine is doing to people's skin.
And that's my next question. The chief brought up, you know, the existence of these drug checking facilities. Are you proposing opening one, or what's the mechanics of this?
Sure, yeah. I think that we would love to. I mean, I think part of it is we need the legislation in place to seek grants and support. They are covered, you know, there has been federal funding allocated to this. We're not looking for state funding at all. And especially for piloting it and getting it out there, research funding is a possibility. I think that what we have seen, and I totally understand the idea that like no one's going to go to these things, but in every other place they exist, they do, and they're overburdened by people wanting tests and samples. And that's a really important thing, because that is something that a person who uses drugs is doing to protect their own health and safety. They're taking action to go check their drugs, and that leads to other behaviors of protecting their health and safety, like reducing use, getting into treatment, whatever it is.
So if someone walks in and they say, "Hey, I've got this. Could you test it?" You have to ship it out, is what you're saying, to have it tested, or no?
Yeah, so in the FTIR machines are a small, handheld, tiny thing. Those are what can be used at the point of care. And so that's where you could say, yes, this has methamphetamine and fentanyl in it. But in order to quantify, is it, you know, 1 part fentanyl and 50 parts methamphetamine or whatever it is, that has to be sent out to a lab. And so previously, when I had provided testimony to the committee, I had sent information about drugs data in those reports, and that's that lab, that's that centralized database that, to be honest, we don't contribute to in New Hampshire, but we benefit from the samples that are being sent in from Maine and Massachusetts and Rhode Island.
Where is this testing facility?
I believe physically they're located in California.
So doesn't that also raise federal law questions with you shipping drugs across the country?
I'm not sure on the particulars about that, but I know that those have been addressed through. Oh, okay.
So I did get to go visit one of the harm reduction based drug testing facilities in Lawrence, Massachusetts. It was incredibly eye-opening, wonderful to see the program. I did ask that question, and it falls under some protections offered because the shipment is going to a research-based university. And so it's part of a research program.
Okay. Any questions from the committee? Representative Newman.
Yeah, could you just give a little thumbnail sketch of what these facilities are like? It sounds like your facility is different from a drug checking facility, and that drug checking facility has to send it to a lab. Could you just kind of clear up the difference between all of that and how successful this is in the other states? Why do people just go there to get it and come?
Sure. Yeah, I would be happy to. So, like I said, in Lawrence, Massachusetts, their drug checking facility sits within a syringe service program or harm reduction program that is sponsored by their community health center and gives them space there. People would walk in, they would be able to engage in syringe disposal services first. So being able to dispose of their syringes within a bio hazard bin. They would then come through, they would meet with a care coordinator who would ask them if they would like to have HIV testing, hepatitis C testing, if they needed help with any wounds, and if they had any drugs to test today. At that point, the person would come in, place the drugs down. The chemist would go through the process of checking each individual sample. To just give an example of how small the samples needed to be, people don't even need to bring in substances. They could bring in equipment that they use to mix drugs, like a cooker or a cotton, a very, very, very small residual amount left over on something, and even that was able to be tested. Then Cole would be able to deliver preliminary results about that. All the while, I would say it takes about 7 minutes per test. And then in that amount of time, people are able to either get their Hep C or HIV testing done, talk to somebody about if they need a safe place to sleep, a warm meal that day, do you need an extra sleeping bag, here's your sharps container, and here are your initial results. And then in about a week to 2 weeks, people, as they come in and out of that center, are able to also receive their confirmatory results, which is what they would send away for.
Thank you.
Sure.
Representative Muse.
I just wanted you to try to maybe expand on a thought that you introduced earlier. You had said that in the mid-Atlantic states where they actually have drug checking in process now, one of the things that they're actually able to do is to identify and track new drugs that come into the system and things like clusters. And you said that currently, because we don't do this in New Hampshire, we don't have that kind of data. And how much of a handicap is it not to have data like that in this state if you're actually really trying to stop fentanyl deaths?
Yeah, I mean, I'll speak to that. It's frustrating. As a public health professional, I wish that the people that live 30 minutes away from me who are in Massachusetts, I wish that I had their range of sight. Their Polaroid picture of their drug supply situation is much clearer than ours is right now. So we don't know which way they're traveling. We don't know what substances we should be focusing a lot of our effort on talking to our participants about. Yes, there are people that utilize fentanyl, but there are also people who occasionally on the weekend utilize cocaine. And so if I had an idea of what our cocaine supply realistically looked like, I knew that those recreational users of cocaine could be an area of focus for us instead of focusing on some other areas where maybe the data isn't going to point us in that direction immediately.
And I will just add that there's also a clinical benefit to this. So we know that there's thousands of hospitalizations in New Hampshire for injecting related infections and wounds. And so as a nurse practitioner in healthcare for the homeless and doing outreach, you know, we've seen these changing wounds, these sores, these things. We think that they're related to xylazine because that's what we've heard from surrounding states. But we don't know that. And it would actually change your treatment decision if this was substance use related or maybe a different bacterial infection. So there's a benefit to reducing hospitalizations and better treating infection as well.
How far away are you from being able to, let's say this became law tomorrow, how long would it take you to get one of these facilities up and running?
That's a great question. I'd love to know the answer myself. But one thing that I had meant to ask the committee was that for whatever reason, the original bill, the effective date was January 1st of next year. And many bills come through as effective in July 1st. And so if that is a possible amendment you would consider, I think we could get there sooner. But if we see this, if this does come through for July 1st, we would be searching for funding, you know, within the months preceding that in preparation. So my hope would be, you know, early within the year if that were the case.
Who is actually we? Is
Oh.
UNH involved in this, or is it just a coalition? Who is this?
Yeah, so it would be New Hampshire Harm Reduction Coalition, and we have service regions for direct service in Stratford County, Manchester, and Concord. And then we support the other syringe service programs or harm reduction programs that exist throughout the state.
So UNH isn't involved. You just happen to work there. Is that correct? Or
I hope that UNH is involved. We'll have to negotiate that later, but you know, there.
Yes,
I,
yeah,
I mean, I think as far as this is something that it falls within my harm reduction research program of research, and preliminary talks. We do have some of this equipment and lab supplies that are utilized for other purposes or no longer utilized. But obviously, I can't speak on behalf of my employer that they're willing to speak that. But once the bill is passed, we can hopefully do that.
any further questions? Representative Stone.
Thank you, Mr. Chair. I have two quick questions, and thank you for taking the questions. The first one is, when someone comes in from the public, what quantity of test strips do you give out?
Whatever they ask for. Typically, we are encouraging people to take the fentanyl test strips.
About how many?
Um,
What's your typical compliment when somebody
So
comes
we
in?
make a kit. We have an overdose prevention kit. Those currently have 2 fentanyl test strips in it. But if someone came in and they had utilized a fentanyl test strip and they felt like they would work that into the way they use drugs, we would be happy handing them 20 or 25 or 30.
Okay, thank you. My second question, if I'm allowed to proceed. You mentioned residual testing. Doesn't that kind of put you in a position where they've already utilized the drugs if you're doing residue testing after the fact of using the drugs?
Yes, you are correct. So sometimes people will come to the drug testing facilities, the harm reduction programs, and say, I used this drug. It did not at all feel like what I was expecting, or I had an overdose. I experienced an adverse reaction that I was not prepared for. Can you please tell me what's going on?
Thank you for clarification.
Sure.
Just really quickly, just because of the, oh, I lost my train of thought with the whole Newman thing. Okay. Never mind. I lost it. I'm so sorry. What was the question?
I think there's something in the air. I don't
Oh,
know.
no.
I mean, I think I think I had it in my mind to ask you this, but maybe it's clear by now. But that by explaining that you can seek grants, you're saying that this is widely accepted. I want to make sure I understand. Like it's federally not just tolerated but encouraged, and that it just comes down to individual states to allow for this kind of activity.
Yeah.
I think that's what I'm trying to wrap my head around. But then also, you know, I failed every science class I ever went in, and you said it was a weight-based measure, but then you talked about Lincoln's Head on a Penny, which doesn't seem like a weight thing. So, but maybe it doesn't matter anymore because you're also saying that residual is fine with you, and like I was looking at the syringe law, the syringe exchange law from what was that, like 2017 or something, and it just talks about residual in there because like obviously you can't exchange a used syringe without also moving drugs. Like you can't transport it to another location because without moving drugs because there's always going to be something in there. So I don't know. That's just a couple of things that were on my mind while you were talking. Was I believe we already have a variety of laws that allow the transport of a minimal amount of drugs for various, you know, for the purpose of various good outcomes, ideally. And then acknowledging that the feds are pretty cool with this, given that they're handing out money for it, and that it's just our job to enable you to do that. And then the difference between weight and Lincoln's Head.
Yes.
Anything you want to say that, but you know, I think the committee's kind of all set too. Thanks.
The Lincoln's Head on a Penny is slightly difficult. We utilize that as just a very quick tool that somebody could utilize if they were using a fentanyl test strip at home. If the mass of any substance out there were significantly higher than what we're seeing substances appear as, then you're right, it would be different. But it's kind of just that these are generally going to be a powder that are around the same weight, and that weight is going to fit about into Lincoln's head on a penny. Additionally, I tell this to everybody, Amazon sells 10 milligram scoops. If anybody feels like looking them up, you are able to gauge very easily how much a powdered scoop would scoop if it was 10 milligrams. I just want to speak to the feds on both bills for fentanyl test strips and all types of test strips, benzodiazepine and xylazine. So SAMHSA and the CDC in April of 2021 actually made a widespread request to all of their funded agencies to say, please start utilizing fentanyl test strips as an overdose prevention tool. So that was April of 21. And while SSPs are covered in being able to dispense those, I don't see enough people each month to make a dent in what would be able to be done if we had recovery community organizations, doctors' offices, med vans, homeless outreach workers, homeless shelters being able to distribute fentanyl test strips as well. And then federal funding. Are the feds okay with drug testing?
Okay. Yeah. And so I think there's many, both public health projects, research projects that are funded federally. It's very interesting when you comment on like it's up to states to make their own decision. Part of what we've seen in other states is when you look at the drug paraphernalia law that this is amending, these terms are in almost every state or were at one point in every state, the cultivating, growing, harvesting, blah, blah, blah. So there's sort of like a template of drug paraphernalia that was enacted in across the states with a lot of variation. And so not anticipating that then drug checking would become this really important overdose prevention tool. And so, then it is up to each state individually to decide to amend them in order to enable it. And the one other thing I wanted to say, the residual piece, that would be fine. I think that would be, I don't see an issue for that, for nominal going away. The only reason it was in there was that residual was in other states got pushed back and they wanted a measurement that was quantifiable. And that was what we came to for what was needed for testing.
Thank you. Okay, I think the committee has enough information at this point. We're going to go ahead and close this work session, and we'll take it up at executive in a little while. We need to move on to the next public hearing. So thank you very much for helping us again. And I'm going to close the work session on 287-470 and open the public hearing on HB 397 and invite the sponsor to introduce the bill if they're here. Who is it? Oh, Representative Phillips.
Good morning.
Sorry for
members.
making you wait so long.
It's all right. Work happens. I apologize. I put my kids out in the hall, so hopefully that wasn't disruptive. My name is Emily Phillips. I'm Rockingham District 7 representative. This has already been passed through Health and Human Services on consent, but what it does is it decriminalizes minor children who handle hypodermic needles or pen tips for, say, their parents who have an authorized prescription for it. I'm a type 1 diabetic, so I actually didn't know this was, illegal, but my daughter will deliver my pen needle to me, or hold my purse with my insulin in it, or my syringes. So the act of her handling that currently is against the law. So this will allow minor children to become what we're determining to be called authorized agents, and as long as they are doing so under supervision of somebody with a legit prescription need, they would be authorized to handle those devices. It's been trimmed down from the original version, so it's a pretty simple bill. I just think it's a law that shouldn't even exist, so we're fixing it.
Thank you. Anyone have any questions? Representative Stone.
Thank you, Mr. Chair, and thank you for taking my question. Has there been any history of any juveniles convicted or charged with a crime of handling a hypodermic needle?
So if they had been, it would be sealed, so we wouldn't know.
There'd be no tracking information
Correct.
handed under their chins.
Correct. I'm sorry, I didn't hear the last part.
There wouldn't be any tracking under their chins?
I don't know the answer to that. So, you know, we don't want to leave. So I think the law as it exists now, there's a flaw there, and you wouldn't want it to be used against somebody under, you know, child family services as a neglectful action as
Just-
it's written now. I think that
Oh.
corrects it.
How did this come about for a change in legislation?
It was I guess last year it was submitted, and there was more to it. There was something about the needle exchange program, allowing minors to have access through that program as well, and some other information. I think it was trying to repeal the entire law, and this just adds the authorized agent aspect. So it was presented to me. So I'm a type 1 diabetic. I carry all my supplies, and another representative says, "You know that you're breaking the law, right?" Like if my daughter holds that, and I said, "No, I didn't." Well, explain this to me. So I was like, "Well, I'll sponsor this." So that's how it came into my hands.
Okay, thank you.
Yes.
Janvin?
Thank you, Mr. Chairman, and thank you, Representative, for taking this question. I spent the last 2 years working at a summer camp. And in that summer camp, the campers are required to be buddies, so that there was always a protection that there would be two of them. And there were some cases where a person had a nut allergy, and his buddy carried his EpiPen. What you're telling me is that under state law now, as it stands right now, that was actually an unlawful act?
Yes.
Thank you.
Another example, and I'm sorry I didn't prepare a written statement, but a teenage babysitter who had to help administer insulin to a child. Although the teenage babysitter was given permission by the parents to help that child, that teenage babysitter is breaking the law. Same thing with an EpiPen. Although the EpiPen thing, it's life-saving, so you could be covered under the Good Samaritan law or something in that example. But there's something called glucagon, which is a life-saving vial that would be. So if I went unconscious, I had a low blood sugar. This product is advised to be injected into my thigh when I'm unconscious. So I've taught my children, who I feel are responsible enough to save my life, because minutes matter, how to use this. So if they did save my life, they would be covered by Good Samaritan. But when I teach them on how to do it when I'm unconscious, while I'm teaching them, it's breaking the law.
Thank you. Anyone else, Jessica? Representative Yokella.
Thank you.
Thank you.
Thank you, and thank you, committee, for hearing my testimony today. I will be able to bring a little bit more history to this, because this was my bill from 2 years ago, and I found the bill because I was looking in the pharmacy statute for something else. And I stumbled across this legislation, or this part of the law, and didn't understand, one, why it was in the pharmacy statute that the kids were prohibited from doing stuff, because the penalties are the same as a penalty for a pharmacist. So that didn't really make a whole lot of sense. And so my first attempt with this law was just to repeal it, because in reality, I think that we're kind of moving away from these penalties about syringes and stuff like that, and just because we saw that when we outlawed syringes, there was an increase of reuse of syringes and stuff like that, and that caused other harms. And so most states are moving away from forbidding the actual paraphernalia and just concentrating on the drug itself. And so I tried to repeal it at first, but that was too extreme for Health and Human Services. So the bill died. However, in the law under pharmacy, there's already a definition of authorized agent. So during this last year, I proposed that we just add the language of saying, hey, there's these children, like the example of the partner or the friend. If you show your friend, if they hold it, if you let your friend hold this, the needle or these auto injectors and stuff like that, it's currently a crime. It's not always prosecuted. However, to Representative Stone's question, there is data. We're not sure about the technicalities of the specific instances, but we do have data on how often these are charged. At least I did get that data as of 2021 when I first put the bill in, and I have that. It was much more charged back in 1998 and 1999. There was up to 117 cases filed against children. But in the more recent years, like 2015, there was 2, and then there was nothing until 2018. There was 1 more, and then 2021 there was 1 more. So it's been trailing off of a lot, and so we don't. Those cases are obviously sealed because they involve minors, so we don't know like what the circumstances of the case were. But I felt that this authorized agent language and making it clear that it has to be for nefarious purposes of the handling of the hypodermic needles, I thought would protect from a zealous prosecution. And so that's why I put this bill in and supported the bill. And I'm happy to answer any questions.
Thank you. Do you have any, what was very concerning to me, and I hadn't thought of this, was the reference the representative made about not necessarily criminal charges, but being used by youth services or whoever to potentially take children out of a home just because of this, because it's illegal. Do you have any data on that, or have you heard anything like that?
Thank you for the question. So there have been a few people. So this bill has 2 sections. One of them is the child is actually committing a crime when you give the child or the buddy the access to this needle when they have possession of it. But also the person that gave the person the needle also is committing a crime. So there's 2 sections of this law that we are changing. And under that law, I also have the stats, but only since 2013. And there was 2 in 2013, 2 in 2014, 4 in 2014, 2 in 2015, and then it skips all the way down to 2018 was 1 in circuit court, and then superior court there's like 1 in 2013, 2016, and then 2 in 2021. So it's not very often that it's been used against adults, this statute, but I don't know the exact nature of those cases and what happened with those adults. If those were dealers or whatever, then it may not have been affected, but it's entirely possible that it could be used in against a parent. Yeah.
Thank you. I can't see your name. Representative Howard, thank you.
Thank you, Mr. Chairman. Thank you, Representative Ucella, for taking my question. So for me, I'm just curious about what if there is a minor driving a vehicle and per se there is a kit for insulin use in the back seat. Could there be a possibility that because they are not being directed that they could be charged still?
Thank you for the question. That was not my language. This is the Health and Human Services. They had some people in it that were concerned that an authorized agent was too broad and so they added some language to try and make it more narrow. I obviously I think that authorized agent is clear enough, but yes, if Emily left her needle in the car and let her kid use the car, but didn't remove the needle, or a neighbor's kid use the car, technically they're in possession of it, and is it under direct supervision? You know, all of that stuff. It seems like they made it unnecessarily restrictive in Health and Human Services, and kind of that's why we're in criminal justice, right? So you can say like that doesn't really make a whole lot of sense. But my intention is just that, you know, if the kid is not using it or not using it for a nefarious purpose, if someone had has it inappropriate purpose, then they're not going to be getting charged. That's the main goal and thrust of this. And to be honest, since there already is, you know, examples of people just being currently committing the crime, I'd rather have something get passed than just keep continuing down this road of people being committing crimes and then selective prosecution. Yeah. So,
Thank you.
Thank you.
Representative Murray.
Thank you, Mr. Chair. I actually didn't realize that we were the second committee on this until you mentioned Health and Human Services. So thank you for doing that, because I was looking at the introduced version of the bill. So with what you're saying, you know, I'm looking at the under direct supervision part with Representative Phillips' example of like her kids having to revive her with a pen. Would then this bill still not cover them because they're not being supervised because she's unconscious?
Thank you for the question. I think that in the emergency situation, there is an exception, like a Good Samaritan exception kind of stuff. And so you could technically be charged, but then have a defense that say, oh, I was being a Good Samaritan, you know, I was saving their life. They were, you know, under. And so you could have an exception, but technically, yes, you would be still under breaking this technical law. And so I think, you know, that's why we're in criminal justice, to make sure the law is correct.
Okay, thank you. And then I just wanted to clarify, so then you want us to pass this as amended, or you would have preferred for us to revert it back to the original language?
Thank you for the question. My ultimate goal is to just clean up the language so that I think that there's no possibility of a child being put in the system unnecessarily and for inappropriate means. And since the law is so broad right now, I'm happy with something, but obviously I think that the bill I submitted was good. And so, but I'm not entirely opposed to, you know, I didn't pull it off in consent and fight it off on the floor. If it got passed in consent, I was happy to move forward with it. So I would prefer the other one, but I'm okay with leaving it as is, or any fixes that you need to pass.
Yeah, I have a
Murphy.
question of the chair.
Oh, go ahead.
And it has to do with our responsibilities here as the second committee. And as I understand it, this is a bill that went through and it was amended by Health and Human Services. So this is the bill that, this amendment doesn't have to be approved. That's what we'll see when we get to a session. Is that correct?
Well, it was amended in Health and Human Services,
Right,
so
so-
that's now the bill.
Right, so we don't have to do it. Now,
We
the
could amend
purpo-
it if we wanted to.
we could amend it if we wanted to. I
Yes.
understand that. So it comes to us as a second committee, and my understanding has been that it comes to us because we are the committee that is involved with the appropriateness of penalties or some other issue that has to do with criminal justice or public safety. So we can amend the policy part of this if we wanted to, but and I'm looking at this and I don't see any penalties or anything that we are looking at other than, we're talking mostly about policy and trying to understand what the
Right.
policy is, so. I think I've clarified it enough to myself as I talked.
Good talk.
Yeah, thank you.
I do want to remind you that there are penalties. It's the same penalties as a pharmacist, and so it is a misdemeanor, I believe, for a person, and then a business, it's like a felony. So
This is just the portion of the statute that's being
Yeah.
amended. The existing penalty portion
Yeah.
remains. Question? Oh, Representative Murphy, I'm sorry.
No, thank you, Mr. Chair. Thank you for taking my question. In regards to the child protection concerns, I'm hearing like the diabetic issue, and I certainly understand that. But having worked in child protection, I know that sometimes these things aren't quite as obvious. And I wonder about those cases that were actually prosecuted, and wonder if it was because there was a child was in possession of a syringe full of an injectable illegal drug, not a not something that's prescribed for diabetics, but having worked and seen enough of those cases, I can certainly see why there are concerns about possession of syringes and with a needle. I'm assuming not just the syringe. We're talking a needle attachment, or that's the question I have. That it sounds a little bit overly broad to me, and I just wondering what the reality is of how many cases are actually prosecuted. Who's gonna the person that would be prosecuted would, I would imagine, would be the parent or guardian, right, of whoever the child they're prosecuting. 6-year-olds.
They can, yes. So thank you for the question. I think we were just giving some examples of possible things. I'm not aware of any Health and Human Service involvement in any of these cases. These would be police charges, not necessarily going through Health and Human Service, or a neglect case necessarily. But yes, they could charge the 6-year-old, they could charge a 17-year-old, they could charge, and they do, and they have. So those were the numbers that I gave at the beginning. Whereas back in 1997 is the first records that I have. It was 78 cases in circuit court and 14 in superior court. And so I could give you the list and forward this information that I had on the cases for these that I got from Richard Head, which is the person for kind of liaison for the judicial system. I got this information from him, and so I could forward it on to you and the committee if that's helpful. I mean, I think you're going to exec it in a few minutes, so I'm not sure how much time you would have time to review it. But there are charges that can be and have been brought, but it definitely starts trailing off to like below 10 cases in 2004, and then it starts trailing way off to like so there was over 100 in 2018 and in 1998 and 1999 there were over 100 cases against minors, and then all the way to 2004, then it starts dropping off to like under 10 cases per year for minors. And so it's not being used readily and anymore. And a lot of some of the officers that came to the hearing last year were surprised there was even a law. They just weren't really aware of it, because who would think to look in the pharmacy statute for charging someone? So,
Thank you.
Thank you. A 6-year-old or whatever. Yeah.
Representative Tenzar, and then you had a question, right?
Thank you, Chairman.
And
Thank
then
you,
Representative
Representative. Those cases that you're referencing, are those New Hampshire cases?
Oh yeah, absolutely. All of these are New Hampshire cases. There. So Richard Head is the liaison for the judicial system in New Hampshire, and so all of these are based on what I asked him to do is look up how many cases were charged under this statute that I was trying to repeal, and so these are all the cases. I'm not sure how many of them would have been covered by this authorized agent exception.
Thank you.
Thank you.
Representative Newell.
So just to clarify with the, if there were charges that there were an illegal substance in it, that would be a separate charge, right? It would be a separate charge for the substance and, possession of the substance, and then a separate one from having the actual syringe.
Thank you for the question. And that was the sentiment that I kind of got from Richard Head, that it was often charged in multiple charges. This was very rarely charged by itself.
Right.
So it's an additional charge that they could plead down to.
That looks like that's it. All right, thank you.
Thank you.
Anyone else? Anyone else wishing to testify on this bill that has not testified? Seeing none, I'm going to close the public hearing. And at this point, we're going to take a 30-minute break, and then we'll come back and exec these.
Gentlemen.
My son, all the older ones, did everything.
But thank you. Thanks for nervous about. I mean, if you're David, hey, let's go right now.
Hi there. Just wanted to let you know that I'm here from the HHS if you have any questions or need the department.
You didn't want to weigh in, right?
What's that?
You didn't want to weigh in on that?
I mean, we are in support of federal test records strategy, so I'm happy to talk about that, you know, and surveillance more broadly is always helpful for
What about the
intervention.
needle, the needle bill?
Yeah, I mean, we don't have any specific.
Okay.
Anything on it. I mean, it's sort of. Yeah.
What about you, Representative SciTech? Did you pick up any of this?
I listened to this last one. That bill should have never gone to HHS to begin with.
No, it should have come to us right away.
So, because it's bad manners to change a policy, but they shouldn't have had the policy to begin with. It should have been vacated.
Yeah. So, but as we have it, what do you think about it?
It's not a big deal.
That's what I think. I don't care either way.
So it seems like reasonable to be.
I'd love to run your committee, and being on a very dysfunctional school board, I'm just really like trying to hold and learn.
I just kind of set a bar at the beginning and everyone.
Yeah, yeah. Well, I appreciate it.
The charges. If you need to, you know, run down to get an amendment or something, just let me know. Yeah. Well, once you guys are on topic, right? We'll find out. So you guys, I was down. So you let me know. Yeah. Say like, hey, we can have an amendment. So, be available.
Hello. Hi. Well, good. I'm in Concord right now, but I'm doing fine. No, I'm finished at 9. I teach from 7:30 to 9. That's right. Expect so, sure. We're trying to make it a little earlier because Donna's now using her scooter or power chair. So we try to move it up, like like 4. Okay, all right. I'll see you then. Okay, right. Bye bye. Hi. 4 o'clock for the Hewards? Okay, well, that's what I told them just a minute ago. Also, I talked to Beth Sargent, and she's, just became aware of this and is, no one, is talking about killing it in the Senate Judiciary. So, your bill, because oh, yeah, she left the meeting here, so she must have got. How are they acting? Okay, all right. That's right. It's study committee. Okay, all right. Let's hope they kill it. But anyway, she Beth sounded like she'd like you to testify before the Senate. Oh well, okay, all right, okay. All right, I'll keep the chair charged. Okay. Well, I wanted to pass on because. Oh, but by the way, I don't know. I have no idea. By the way, the stakeholders were Helen. Yeah, because Beth was there for them. She go. Nobody. The only person that wanted this was the subcommittee. I mean. Okay. I don't know that they have to. Maybe post it in the hallway, kind of thing. I don't know where it's supposed to be, but where's it? Well, okay. Well, it's certainly, well, I don't know, is it worth something, is it worth mentioning, but, okay. All right. No, I guess just wanted to go to the bathroom or something. I don't know. I'm trying to keep my head down on this because I've done even less work than usual, which is, it's a pretty low bar as it is, so. Anyway, I just thought I'd pass that on, all right? It's like 5 bills to exec. We haven't execed anything yet. All right, we'll talk later, okay? Bye-bye. I'm live?
At this point, I'm opening the executive session on House Bill 287. And I'm going to recognize Representative Reed for a motion.
Thank you, Mr. Chairman. I move to OTP.
Is there a second? Representative Prue seconds. And would you like to speak to your motion, Representative?
Yes, I think House Bill 287 is a good harm reduction tool, and I can only see positives with this bill. Thank you.
Representative Prue, would you like to speak to your second?
I feel the same way, and not much else to add. I think it's a good bill.
I am. I'm going to say I agree. I think that this the clean first step for this is just the test strips. However, I do see some value in House Bill 470, and I'd like to see where they're going with that. There was discussion of some kind of testing center, and I think that those are interesting ideas, but I'd like to see a little more definition and a little more plan before we legislate, and I'd like to legislate to that versus just throwing it open and then figuring out what comes of it. Having said that, 287 I strongly support. Anyone else would like to speak? Representative Rhodes?
Thank you, Mr. Chairman. I will vote for the ought to pass motion for the test strips. I just feel like I have to say, I do actually have concerns about it. I am looking at the other side of the coin, and I almost look at this as we're telling people that it's okay to go out and do drugs as long as you test them first, and I do not agree with that. If this is going to save somebody's life, then great. I don't think that this is going to do anything to stop the drug problem. I don't think that this is going to do anything to help get the fentanyl off the streets in any way, shape, or form. And hopefully I'm proved wrong. Again, I will vote for it, but I do have tremendous concerns, but I'll take your guys' all word that this is the right thing to do.
Thank you. I will say that I share your concerns, but for me, it's a matter of, as a parent, being able to have something like this at my disposal. If I find something in my child's, stuff, to test and see what it is. Just from that alone, I think is a good standpoint. Further discussion. Representative Sytek.
I just might mention that's an attitude that's coloring all of my outlooks on the various bills we're looking at. Chief, last name from Bedford, pointed out in his testimony that we're really not winning the war on drugs, so why even bother? Part of me acts that way. So I hear Representative Rhodes fighting. I'm ready to say legalize it, make them like lifesavers, but that's not responsible. But it's a sense, unfortunately, that I have.
Thank you. Further discussion. Seeing none, I'll ask the clerk to call the roll. The motion on the floor is ought to pass on House Bill 287.
Vice Chair Rhodes?
Yes.
Representative Pratt?
Yes.
Representative Sytek? Representative Prue?
Yes.
Representative Janvrin?
Yes.
Representative Mannion?
Yes.
Representative Reed?
Yes.
Representative Stone?
Yes.
Representative Tenzar?
Yes.
Representative Gathright? Representative Muse?
Yes.
Representative Bolden?
Yes.
Representative Bradley?
Yes.
Representative Murphy?
Yes.
Representative Newman?
Yes.
The clerk votes yes. Representative Newell?
Yes.
Representative Howard?
Yes.
And Representative Vogt?
Yes.
Chairman Roy?
Chair votes yes.
Motion is unanimous.
House Bill 287, motion about to pass, carries unanimously. Any objection to consent? That will go on consent. With that, I'll close the executive session on House Bill 287. Open the executive session on House Bill 470. I will recognize myself to make a motion. I'm going to move retain. Do I have a second? Seconded by Representative Gathright. I'll speak to my motion. As I said in the previous executive session, I don't think that this bill is quite ready. I think that we need a little more information on how these if these testing centers are going to set up, I'd like to see what they look like. I have some grave concerns about what happened with some of the needle exchange programs where it ended up being places where people would go to do drugs. And I'd like to see some actual information, some protections, some guardrails. I just think it needs a little more work. And I think legalizing this ahead of some type of a plan kind of puts the cart before the horse, which is why I'd like to retain it so that we can maybe do some work on it and come out with a piece of legislation if necessary. Would you like to speak to your second, Representative Gathright?
Yes. After speaking to the prime sponsor, and he was okay with the retain, I am as well. I think there's a little more work that we can do with it.
Thank you. Further discussion? Seeing none, I'll ask the clerk to call the roll. The motion on the floor is to retain. Oh, did I miss somebody? I'm sorry, Representative Means. Go ahead.
Yeah, I just wanted to say I support the motion to retain the bill because it is important that we get this right. And I think having a little bit of extra time to do that will help us not only get the bill right, but hopefully to build more consensus around the fact that we actually need to do more in New Hampshire to save lives. So what retaining will do essentially is put us in a position where we're not killing the bill, we're not forcing a vote on the floor where people are going to have to make a black and white decision. What we're going to do is we've passed 287. That's on its way. So legalizing fentanyl test strips is on its way to happening, and I believe it's on consent. So that's a very positive thing. And what retaining this bill does is it puts us in a position to actually build on that good start later on this year and introduce legislation, or not introduce legislation in the next session, but actually to change this legislation so that we actually can address the issues that have been raised in a sensible way and keep making progress. And I think that is what we need to do in order to make a dent with the overdose deaths that we're seeing in New Hampshire. So would I have liked to have seen this bill go through? Yes, because there are probably lives that a bill like this could have saved. But it is important to get it right. It is important to get consensus. And it is really important in this legislature to get it passed. So I think that's what we're going to work for.
Thank you, and I wholeheartedly agree that if we were to pass it today, all of us still have questions of our own, and our colleagues on the floor would have questions, and I don't think we'd be able to answer them. So I don't think it would have a positive future if we were to just cut it loose like it is. So I agree we should do some more work on it. Anyone else? Seeing none, I'll ask the clerk to call the roll. The motion on the floor is to retain House Bill 470.
Vice Chair Rhodes? Representative Pratt?
Yes.
Representative Sytek?
Yes.
Representative Prue?
Yes.
Representative Janvrin?
Yes.
Representative Mannion?
Yes.
Representative Reed?
Yes.
Representative Stone?
Yes.
Representative Tenzar?
Yes.
Representative Gathright? Representative Muse?
Yes.
Representative Bolden?
Yes.
Representative Bradley?
Yes.
Representative Murphy?
Yes.
Representative Newman?
Yes.
The clerk votes yes. Representative Newell?
Yes.
Representative Howard?
Yes.
Representative Vogt?
Yes.
Chairman Roy?
Chair votes yes.
Motion is unanimous.
So House Bill 470 has been retained, and that'll close the executive session. We'll see. With that, I'm going to. Yes, we do. Yeah. And with that, I'm going to open executive session on House Bill 397. And I'm going to recognize myself for a motion again. I'm going to move ought to pass on House Bill 397. Do I have a second?
I will second that.
Who was first? I think Prue was first. Yeah, I think, well, maybe. And I'll speak to that. We had some discussion that this bill probably is not necessary based on several other bills that make it legal already with regard to prescriptions. And we also heard that there's probably not been anyone prosecuted recently or for some time just based on the fact that they had needles and it was always some other type of substance involved. So it wasn't just a needle. Having said that, I do think that the bills, at best, it's not going to hurt anyone. And it could possibly help with regard to cases involving custody and things of that nature where someone tries to use that. So if it's still hanging out there that there's a potential that it's illegal for a child to have their parents' EpiPen or their insulin, I don't think it will hurt to pass the bill. Would you like to speak to your second, Representative Pratt? I meant Prue.
I agree that, one, I'm not really sure if this is necessary, but if it helps to prevent an innocent person kind of getting sucked up into the system, I'm okay with that, right? Because I know when I was a kid, my cousin was a diabetic, and I used to carry his glucagon for him as well. So I get that whole piece that somebody might be holding a syringe, and somebody might look at them and say, well, why do you have that? You have no reason to have it, but this will cover them and take away all that. So that's it.
Thank you. And I agree as well. The first thing I look at on a piece of legislation is do no harm. In this bill, I don't see a way where it's going to do any harm. So if it's possible to do a little good, then so be it. Further discussion. Representative Newman.
I just have a question that I don't think was answered or even asked in the public hearing. Has to do with the last sentence in the first paragraph that says use of a hypodermic needle or hypodermic needle contrary to the intent of the prescription is not permitted under this statute. So I don't know use of by who does that mean, or does that just mean whether when the person, when the authorized agent who is a minor is found with a needle that has something in it other than what the intent of the prescription said, what exactly does that mean to what's going to happen to that child?
Well, according to all it does as far as the bill is related is it would take away the protections of this bill for that child. So whatever would then normally flow from his possession of that illegal substance would happen. This bill only covers them with protection if they have a syringe with the prescription substance in it that's supposed to be in it. Go ahead.
So that means they would be subject to whatever the penalties of the law are, whether they are a trusted agent or not. Thank you.
As far as I can read it, the only protection that this bill gives is someone who is using it the way it's supposed to be according to the prescription. Further comments, questions? Representative Stone.
Thank you, Mr. Chair. I'll be voting against or out of pass on this bill. I don't think the testimony today provided really compelling reasons to change anything. In the juvenile system, as some of us know, if it's possession of, say, a residue case involving a syringe, that's really the selling point, and there's still no real disposition at the end of that. I just see this as problematic if you're going to allow minors to have possession of needles without really having, again, another mechanism to enforce anything. It kind of puts us where they balance each other out.
Thank you. Anyone else? Representative Sitek.
Would somebody refresh my memory? What was, I thought Representative Iocella was talking about an amendment that HHS put in. What bill was that about? Because there was no amendment on this.
No, this is the amended form of the bill. They amended it when they had it in their possession, and they amended it to add, what did they add? The authorized agent. Okay. Anyone else? Our Representative Harriet Gathright?
I don't know. I struggle with the bill as well. I'm not going to be voting in favor of the bill. One of the things that was brought to our attention was in the bill, it uses RSA 318. However, when the question was asked, the cases, there were other charges, which led me to believe that they probably were teenagers, not like children 12 and under. I would have liked to, since the prom sponsor received it from Attorney Head, I would have liked to have had a conversation with him about the information that was given out today. So for that reason, I believe that the young people were charged because of what might have been in the syringe, and or they might have been users themselves. I don't know. I'm just throwing that out there. So I
Thank
will
you.
not be supporting this.
Thank you. And it's also possible that they weren't, so I guess we just don't know. Representative Howard.
Thank you, Mr. Chair. I am in support of OTP. I believe that this bill would remove the opportunity for minors to actually become victims. And any opportunity to limit a juvenile going into a prison system is beneficial because, of course, it affects their lives and could potentially ruin that life and lead them down a path that we would not like to see them go down. Thank you.
Thank you. Representative Stone.
Thank you, Mr. Chair. Just to clarify for the committee, any juvenile who is found in possession of a needle, even with, say, heroin or cocaine residue, is not going to go to jail or prison. That's reality under New Hampshire law. Secondly, in 2001, the state of New Hampshire, this legislative body, ended up decriminalizing possession of a needle without a prescription. And like I looked it up, and it was in 2001. So we haven't really had, I think, significant issues involving juvenile population to justify this bill. Thank you.
Representative Bolden.
Just going off the last 2 points that were made, I think it's important to consider the impact on a life that simply an arrest or charges can have, even if they end up being dropped later. And I know that, for example, in some schools, minors can face disciplinary action on the part of administration just by virtue of having been charged, and that can affect their ability to attend classes and continue with their normal curriculum. So there's a lot on the line, even if we think that someone isn't going to end up in the prison system.
Thank you. Representative Murphy.
Thank you, Mr. Chair. I agree with Representative Stone, the points that he's made. In terms of prosecution of children under 12, I'm not aware that actually happens. I know there were a few cases cited, but none of the details really available around that. So, I mean, I think it could lead us to speculate all kinds of things. But the reality is that at worst case scenario, there were a lot of numbers, maybe in 1997 or 8 that the sponsor mentioned, but they've decreased significantly to be virtually non-existent. I don't think that this bill is, what's being written is already it's already legal. So I don't think we need to legislate it. So I'll be voting in opposition.
Thank you. I think it's safe to say this bill will not be going on consent. Representative Prue.
So with the information that Representative Stone just gave us, I don't think I can support this anymore. And if I need to withdraw my second and let somebody else do that, I'll be happy to. Because if it's already legal,
I don't
for
think
people
we
to
need to
possess
recess.
syringes
I think we'll
in
just
the
go
state,
forward.
then I don't think this is necessary.
Okay. Well, we don't need to. You don't need to withdraw your second unless you want to. You
No,
just
I'll
vote
keep
against it.
but I'm going to vote against it.
Okay, that's fine. Representative Newman.
Yeah, I just have a question about the discussion that we've been having here. I just heard that it's legal for minors to have needles in the state. Is that correct? Because the answer to my previous question was that this bill doesn't really have an effect because if there's a illegal substance in the needle, whether they are whatever authorized agent or whether they are just a juvenile that has something that is contrary to the prescription that they are authorized to have, they are then subject to whatever the penalties are. So I just don't see what this law is going to do.
Representative Stone, would you be willing to read us that portion of the statute?
Mr. Chair, that would be the portion of the new language.
No, I mean the one that says that it's currently legal for the minors to possess a
It's
hypodermic.
currently not listed as being legal, but what it is the testimony we heard today of say a diabetic parent having a syringe. I believe the example was they were unconscious. There's a competing harms defense, and I can't really envision going through the law enforcement process and including going to the judicial process of a judge not using reasonable expectations that would be a competing harms defense.
No, but I thought you said that it's currently legal for everyone. 2021.
That was the adults.
Oh,
They decriminalized it in 2001 for adults. The juvenile statute, again, though, if you have the syringe and it's under the law, I can't really envision many law enforcement officers taking action on that unless there's an illegal substance in the syringe itself, which makes it illegal.
Okay, so
in
we're back
itself.
to it. It is currently illegal, just that it most likely will not be prosecuted.
Correct, Mr. Chair.
Representative Sitek.
I want good legislation, not prosecutorial discretion.
Thank you. Representative Murray.
Thank you, Mr. Chair. I just want to bring it back to the points made by Reps Bolden and Howard that, even if Representative Stone, you can't see like law enforcement realistically enforcing these things, just having the opportunity to do so still can leave a negative impact to the public, as mentioned by Representatives Bolden and Howard. Just having charges in and of itself can severely negatively impact, especially a child's life. And I think that taking care of your parent, and this bill has been very clear that it's about prescription drugs. It's not just needles in general. I don't think this brings any harm to children, and I will be supporting OTP.
Thank you. Representative Harry Cathright, did you have a comment?
You can be an authorized agent, and a few of the young men on this team today were authorized agents for family members at young age. So by law, you can do that, but there's training that goes with that. A lot of training from what I understand. So for any parent or anyone that feel they want their child to be their authorized agent can do that today. So for me, I don't know why we have the bill here.
Do you know what that statute is that would authorize agents?
We can look it up.
Yeah, if there is such a statute, I think that would have a bearing because that would make this duplicative. Representative Bolden.
I'm just wanted to provide some input on the whole discussion over whether or not it is illegal. The bill has the RSA that says that it's illegal to furnish a hypodermic syringe to a person under 18. That's the part of the law that's being edited by this bill. So it says, the law currently says no person shall sell, furnish, or give to any person under 18 years of age an instrument commonly known as a hypodermic syringe, hypodermic needle, or any other instrument adapted for the administration of drugs by injection. And so the bill scratches a bunch of that out and then adds, unless the recipient is acting as an authorized agent for another as defined in RSA 318:42. So I don't know if that's obvious to anyone else, but it seems obvious to me that the intent of the bill is to maintain that it is illegal for minors to access syringes that are not being used for medical purposes.
Thank you, and for pointing out the obvious, as we did not look at it. So yes, the current state of affairs is it is illegal to give a minor a syringe, and this bill would just carve that out and say, unless they are an authorized agent, and this is the only place in statute where that is dealt with. So I do not see the harm in carving that out. I think. Go ahead, Representative Newell. Newman.
Yeah, I also don't see the harm in carving that out because it protects the authorized agent now from the possibility of being arrested because it's carved out if in fact they're an authorized agent and if in fact there is no illegal substances in the, and it may be as Representative Stone said that even if there is, they're not going to be arrested or not. But I think this gives specifics where people might get a benefit from having e-minors available to help them with their prescription drugs, and where you would take away for that authorized agent the possibility of being having to be in contact with the criminal justice system.
Okay, I think we've pretty much beat this up pretty good. I would ask the clerk to call the roll at this point. The motion on the floor is ought to pass. Thank you.
Vice Chair Rhodes?
Yes.
Representative Pratt?
No.
Representative Sytek? Representative Prue?
Prize, yes.
Representative Janvrin?
Yes.
Representative Mannion?
Yes.
Representative Reed?
Yes.
Representative Stone?
No.
Representative Tenzar?
Yes.
Representative Gathright?
No.
Representative Muse?
No.
Representative Bolden?
Yes.
Representative Bradley?
No.
Representative Murphy?
No.
Representative Newman?
Yes.
The clerk votes yes. Representative Newell?
Yes.
Representative Howard?
Yes.
Representative Vogt?
Yes.
Chairman Roy?
Chair votes yes.
Motion passes 14-6.
Okay, so House Bill 397 passes 14-6. It will not be on consent. And who was going to do the minority report? Representative Stone is volunteering to do the minority report.
Just for clarification, Mr. Chair. Mr. Chair, I'm sorry, if I may, the recommendation that you would have had would have been ITL?
Yes.
Thank you.
And with that, I will close the public hearing on HB 397.
And it was, what was
Excuse me, the executive session.
Representative Murray, what was the vote? 14-6. 14-6. Thank you.
And I will open the executive session on HB 305 relative to the options for violations of the presidential orders. Did we have a motion on that?
We didn't even discuss that. They did a
We did a subcommittee.
they did a subcommittee, so I would ask whoever was the chair of the subcommittee to make the motion.
And who was that?
I think it was Tenzar, because he was the one that.
Representative Tenzar, was this the subcommittee that you did?
Thank you, Chairman. Yes, it was.
And do you have a motion you'd like to make on the bill?
We had a motion of ITL.
Okay. And is there a second?
Second.
Would you like to speak to your motion?
Yes, thank you, Chairman. While this bill did have good intent, it was a bill that took a lot to pass last year. This was an amendment to, I believe, 1778. I may have the incorrect House bill. But the intent of this was to increase the level of violation from a violation to a Class A felony. We thought the amount of time and effort that it took to even squeeze by the bill that passed last year would almost be a slap into the face of everyone who tried to work on this last year. So we think that at this time that it should be ITL'd.
Are you talking about HB 305?
Yes.
Okay. You want to speak to your second, Representative Harry Gathright? Any discussion? Representative Tenzar, could you help us out with regard to this bill? Just a little explanation.
So this was a very confusing bill to begin with, and while we were in the subcommittee. Speaking with Representative Mannion, he did do a good job to try to explain it the best he could, but you may know, Chairman Roy, the bill that was passed last year that I think Senator Abbas was the prime sponsor on, that this went through so many different committees, judiciary, and they got the best that they could get, and they think that if we try to introduce this, that there's going to be a problem going forward with other bills. So we think that while it may look like a good bill now, it's too much to put forward at this particular time.
Okay. Thank you. See no further discussion. I will ask the clerk to call the roll. The motion on the floor is inexpedient to legislate.
Vice Chair Rhodes,
Yes.
Representative Pratt,
Yes.
Representative Sitek, Representative Prue,
Yes.
Representative Janvin,
Yes.
Representative Mannion,
Yes.
Representative Reed,
Yes.
Representative Stone,
Yes.
Representative Tenzar,
Yes.
Representative Gathright, Representative Muse,
Yes.
Representative Bolden,
Yes.
Representative Bradley,
Yes.
Representative Murphy,
Yes.
Representative Newman.
Yes.
The clerk votes yes. Representative Newell,
Yes.
Representative Howard,
Yes.
Representative Vogt,
Yes.
Chairman Roy.
Chair votes yes.
Motion is unanimous.
So any objection to consent? None. HB 305, inexpedient to legislate. I hereby close the executive session. Open the executive session on HB 512. Was there was Representative Janvin, did you have something to tell us about this bill? HB 512? That's okay.
I distributed to everybody on the committee an amendment. This is amendment 06058. Let me try turning on my microphone. There we go. You should have before you amendment 0605H. And you have to have the underlying bill in front of you. This is going to, if you go to page 2 of the original bill, page 2, line 13 through line 24, this will remove that entire section. And as you see in the amendment, that it's going to renumber 159F5 as F4 because F4 is being eliminated, the one that deals with penalty. So again, this will allow firearm accessories manufactured in New Hampshire to be sold in New Hampshire without any federal oversight. So long as they never leave the state of New Hampshire, it's not considered interstate commerce.
Mr. Chair, if I may, could we just have maybe a minute, because a lot of us are looking for the bill or trying to pull up the
Yeah.
bill.
Everyone, 5 minutes, just get your bills. All right, we're going to restart the executive session on HB 512. And I'm going to recognize Representative Jambrin for a motion.
I move OTP on Amendment 0605.
I'll second. Okay, Representative Prue second it. Would you like to speak to your motion, Representative Jambrin, on the amendment?
Yes, thank you, Mr. Chairman. The basic tenet of this bill is not to punish our police officers, our law enforcement in the state of New Hampshire, or remove them from office. What we would like to do is to recognize that under the Interstate Commerce Clause of the United States Constitution, that something that's manufactured in the state of New Hampshire, sold in New Hampshire, never leaves the state of New Hampshire, is not subject to federal oversight. And that's all the bill is doing.
Representative Prue.
I did.
Yep. Representative Prue, would you like to speak to your second?
Sure. I tend to agree that an officer may be put in a position where he has to act on this, and to penalize him for doing his job, I don't agree with. So I'm glad we've taken that out.
Anyone else? Representative Pratt.
So I don't believe in penalizing police officers. Maybe from an officer, they may have an order from somebody higher up, and they have to follow the order. But what teeth are now left in this bill? Is there any teeth left in this bill?
Yeah, again, the basic tenet of the bill was to make it so that New Hampshire recognizes as a policy that something made and sold in the state of New Hampshire, never leaves the state of New Hampshire, is not subject to federal oversight.
Okay, thank you.
So to be clear, it's your intent that this bill is actually more of a policy statement than anything with actual teeth, correct?
That is correct.
Thank you. Further discussion? Representative Stone.
Thank you, Mr. Chair. I'd also like to point out that a similar bill was passed, Texas House Bill number 957 was passed in 2021 that expressly exempts federal regulation firearms that are made in a state from being entered into commerce as well.
And was that bill signed into law in Texas?
It was.
Representative Harry Gathright.
How do I say this? I think that this, to say that you can't, everything that's manufactured here must stay here. How do you know that? Because once I purchase something, I can do what I want. That's a reality.
I can try to answer that if you allow me to.
Just let's stick to the amendment first.
Yeah. Okay.
Yeah. Then we can, Representative Muse on the amendment.
Yeah, on the amendment, I will vote to support the amendment. It makes a bad bill slightly better, and that's never a bad thing. So I support the amendment.
Thank you. With that, I'll ask the clerk to call the roll on the amendment. The motion is to adopt amendment 0605H.
Vice Chair Rhodes?
Yes.
Representative Pratt?
No.
Representative Sytek? Representative Prue?
Yes.
Representative Janvrin?
Yes.
Representative Mannion?
Yes.
Representative Reed?
Yes.
Representative Stone?
Yes.
Representative Tenzar?
Yes.
Representative Gathright?
Yes.
Representative Muse?
Yes.
Representative Bolden?
Yes.
Representative Bradley?
Yes.
Representative Murphy?
Yes.
Representative Newman?
Yes.
The clerk votes yes. Representative Newell?
Yes.
Representative Howard?
Yes.
Representative Vogt?
Yes.
Chairman Roy?
Chair votes yes.
Motion passes 19-1.
Okay, at this point, the amendment is adopted. Representative Jambrin, would you like to make a motion?
Yes, Mr. Chairman, I move ought to pass as amended for House Bill 512.
Second.
seconded by Representative Prue. Representative Jambrin, would you like to speak to your motion on the underlying bill?
Absolutely. Once again, the bill as amended would allow an item manufactured in the state of New Hampshire, sold in New Hampshire, and remains in New Hampshire, and I can explain that to the question of the representative earlier, to not be subject to, that we acknowledge it is not subject to federal oversight. And by that, I mean, I'll give you two examples. Again, as I've stated many times in committee, I served the last 2 summers working in a camp setting where I am a firearms instructor, teaching youth to safely utilize firearms. And one of the problems that we've realized early on was that the ear protection was not suitable for a youth. It's made for an adult, and therefore the youth were actually exposed to high levels of noise. The whole purpose is to reduce harm reduction in the ear protection. So utilizing a suppressed firearm would be in the best interest of those scouts. I shouldn't be using the word scouts, for those youth. And that this bill would allow a suppressor made in New Hampshire, sold or donated to the camp, to be utilized in the camp setting and never leave that camp without any federal tax being against the camp. The second situation would be a firearms school where they have a range, an indoor range, and I can think of at least 4 of them that I know of in the state of New Hampshire, where the person that owns that range could go to a manufacturer that makes a suppressor, purchase that suppressor, have it on the range, and it never leaves the range, and it would not be subject to the federal tax. So that's basically what this bill is trying to do, is to acknowledge that if it's made in New Hampshire, sold in New Hampshire, and remains in New Hampshire, it is not subject to federal oversight. I hope that answered the representative's question.
Well, if it did, it didn't answer it for me. I'm curious, how does this, how do you keep, in other words, to the representative's point, if I go to Zig and buy a gun from them directly, because they're manufactured here in New Hampshire, how does the law contemplate me moving to Florida with that and thus bringing it into interstate commerce? You can't. Representative Seitz.
Isn't there something with full faith and recognition clause of the Constitution? If you get married in Connecticut, you're married in New Hampshire. So if you bought this legally, you had it all done here legally, you're not doing any commerce. You're transporting your personal property to Florida. So I don't like the, never mind. I've said it.
Representative Stone.
In the case of firearms, it would be similar to you're required by ATF to manufacture it with markings saying that it was manufactured in the state of origin and your manufacturer's name that you're on file with. Generally, some states do not allow suppressors. So if you were to move to a state that specifically by state law prohibits them, you would not be allowed to bring your personal property to that state.
Representative Newell.
Just a point of clarification on that. Is that a federal regulation
Which part?
for it to be labeled that it's made in New Hampshire?
Yes, that's a
So-
requirement of marking variants through ATF, and all firearm manufacturers are required to do that by federal law.
Right, but if I'm not mistaken, what this bill says is that these things would not be subject to federal regulation. So would they be subject to that federal regulation to be labeled?
You would not be able to manufacture it without a federal firearms license. So you'd have to comply with it. But you're not entering into commerce.
But what this bill is saying is that things that are made here are exempt from federal regulation, and you're saying that a federal regulation would ensure that it's labeled that way.
Yeah, just follow up clarification. Most manufacturers will sell their products to other members in different states. Therefore, you're taxed on that based on how many units you make individually. And there's a reporting element at the end of every year where in April you have to fill it out. So at the end of the day, if you're manufacturing it, it's marked where it's made. And if you're entering into commerce, you're taxed accordingly. If these are subject, I believe, not to be taxed if they're going to be residing in New Hampshire and not entered into commerce.
If you look at page 2, line 10 through 13, I'm sorry, 10 through 12 of the bill, the state law would be a firearm manufactured or sold in New Hampshire under this chapter shall have the words made in New Hampshire clearly stamped, inscribed, or otherwise marked on a central part of the firearm, such as a receiver or frame. So,
Thank you.
Representative Muse and then Representative Bolden.
While I appreciate the removal of the penalty part of the bill, I think there are some other things that we need to be very much aware of during our conversation. One is I understand that the new intention of the bill is really to serve more as a policy statement in New Hampshire, but the reality is this would do something that HB 1178, which we passed last year, did not do, which is outright nullify federal law in New Hampshire. The courts have consistently ruled that nullification laws are not constitutional when states pass them. Missouri's law, which is different from the one we passed last year, but similar in some ways, was actually found unconstitutional last week. One of the ways that folks treaded around that issue in 2022 in New Hampshire was to take advantage of some earlier court rulings that basically said that the federal government couldn't commandeer state resources. So one of the reasons why that particular bill passed the muster of the Attorney General was because it wasn't likely to be immediately overturned by a court. Another issue that I see is it's extremely broad. If you look at the bill, it encompasses springs, screws, nuts, and pins. You're going to need a pretty small stamp to stamp made in New Hampshire on some of those things. The other thing is, what is to prevent somebody in China from stamping made in New Hampshire on a firearm and claiming the protection of New Hampshire law? How do we have any way of really knowing where a firearm is from? Perhaps some of the in-state manufacturers can prove it, maybe not. It makes it very difficult to enforce it. One of the issues that comes up with a lot of the laws and bill proposals that we discuss is, well, how would it be enforced? I don't know. How would it be enforced? It's a policy statement. So whenever a bill is framed as a policy statement, it almost infers that it really doesn't matter how it's enforced, which tells me maybe this shouldn't be a bill. It should be more of a House resolution, which is what the folks who had the House resolution in one of our previous session days on urging Congress to ban assault weapons we're trying to do. The other thing and the last thing that I'll point out is I think there's a difference between supporting a constitutional right and creating special rights. And I think that if we pass this bill, we actually kind of cross the line when it comes to that. So I just urge, there are just a lot of reasons to sort of slow down on this one. And I would just urge my colleagues to maybe take a step back and take another look at it. Thank you.
Representative Bolden.
Thank you. I don't think I was present for the hearing on this bill, and I was wondering if anyone recalls whether any manufacturers working in New Hampshire gave testimony, because I found it interesting to hear that Texas passed a similar bill, and I just tried to find it. Google. This was the top search result. This is not selective Googling, but in this article, they're saying that it was passed in 2021, and as of January 2022, when this was written, the manufacturers in Texas were pretty frustrated because it was affecting their ability to have out-of-state sales in some way. And I'm not going to claim to understand anything about this industry, but I guess it's because if the manufacturers worked in state, the ATF said we're going to impose sanctions anyway, and they didn't care. And then the state law said, well, ATF, we're going to put you in jail. And then the ATF said, well, that's fine because we just won't let you run your operation outside of the state of Texas. And so it's been a tit for tat thing that's kind of seems to have resulted in a stranglehold on the silencer or suppressor manufacturers in Texas. And as of this January 2022 article, they're waiting for the law to be changed and they're not happy with the result that they got. And I thought that it would be worth throwing that info out there.
Thank you. I actually am tending to agree. I don't see Zig Zauer, who has billion-dollar contracts providing weapons to our military and selling firearms around the world, would limit themselves by engaging in this where they have the potential to lose billions of dollars of business by not being able to ship their firearms out of state because of a few suppressors sold here. Representative Rhodes.
Thank you, Mr. Chairman. I may be looking at this wrong, and I think that there has to be a level of standard on anything that is made. And the concern that I'm having is, if you use a product incorrectly, then that's just a product. If I use my pen wrong, it's not the manufacturer's pen's fault if I use my pen incorrectly. However, if there is a defect with the product, we wouldn't tell a car manufacturer that if their seatbelts weren't, properly installed, that the user is at fault. So again, I may be looking at it differently or not understanding it, but I have concern with it.
I don't, could you follow, what does it have to do with defects? I'm confused.
So let me go back and read it because my understanding was that the testimony they were talking about, the testimony that was given was about they were talking about them not having to be, if they wanted to manufacture in New Hampshire, it didn't have to have the same standard as something else. It didn't have to follow the same rules. But however, that was a long time ago. But those are the notes that I have written down. So, and Representative Jamron's looking at me with crazy faces, but that's what I wrote down. So I'm not really sure where I'm.
I don't know. Representative Jamron, do you have any response? I didn't see anything about that. Representative Murray?
Well, first, I think what Representative Rhodes is trying to say is if we're taking away the standard, then there could be defects and stuff that are not going to be addressed. Maybe I'm misinterpreting that, but I feel like your intent, Representative Jamron, it sounds like more of the taxes rather than the regulations and the standards of how these weapons are manufactured. So is it possible that we could get an amendment that would clarify language in the bill or retain it so you could amend that language and make it more pertinent to the issue you're trying to address?
Quite frankly, if we were to go in and strip every single thing except for the number one, definitions, and two, on page 1, lines 17 through 20, that was the only thing that this committee decided to pass, I'd be happy, as I think it would cover the situation that I'm talking about.
It's a bad bill.
Thank you, Mr. Chair. At the heart of this bill, just like in Texas, it's an issue of taxation. That is what it boils down to, is taxation by the federal government on requiring a $200 tax stamp be paid for any suppressor or NFA item. Texas's bill, if you actually read the bill, is actually a lot more comprehensive than what's been presented here before this session.
Based on you reading of that bill, do you feel like this bill would benefit from a more comprehensive look at it, or?
If we wanted to clean the bill up, I think we should retain it.
You agree?
I'll withdraw my motion to vote TPA if you want to retain.
And I just want to comment, I'm not sure that I agree with retain, but I do, if I look at the definition in the first paragraph, it has bump stocks in it. Now, I've forgotten whether they're illegal or not, or presidential ladder, but they happen to be in there, so this is overly broad.
Bump stocks are actually legal again, I believe, after a short hiatus. Representative Saitek?
I'd like to see retain because, look, for me, what's at this bill, in this bill, is it's a stalking horse for the overreach of the federal government and the elastic clause and everything that I dislike about the federal government. And we're not able, New Hampshire, to put our thumb effectively in the eye of the federal government. So as much as I would like to do this symbolic gesture, it's useless. And I just as soon have it retained and walk out the back door because we're not going to really win anything.
Representative Janvrin, would you like to withdraw your motion about to pass?
I will.
And Representative Prue, would you withdraw your motion of second?
You betcha.
Representative Janvrin, would you like to make a new motion?
Mr. Chairman, I move to retain House Bill 512.
And I'll second that. Keeping it.
I think we've had enough discussion. I'll ask the clerk to call the roll on retention of HB 107.
Vice Chair Rhodes,
Yes.
Representative Pratt,
You said 107?
Oh, excuse me, no.
512.
512.
512.
No.
Representative Saitek, Representative Prue,
Yes.
Representative Janvrin,
Yes.
Representative Mannion,
Yes.
Representative Reed,
Yes.
Representative Stone,
Yes.
Representative Tenzar,
Yes.
Representative Gathright, Representative Muse,
Yes.
Representative Bolden,
Yes.
Representative Bradley,
Yes.
Representative Murphy,
Yes.
Representative Newman.
Yes.
The clerk votes yes. Representative Newell,
Yes.
Representative Howard,
Yes.
Representative Vogt,
Yes.
Chairman Roy.
Chair votes yes.
Motion passes 19-1.
The bill is retained, and I hereby close the executive session on House Bill 305, and I open the executive session on House Bill 107. And do we have a
That would be Representative.
Representative Mannion? Would you like to make a motion?
Yes, thank you, Mr. Chairman. I make a motion ought to pass on amendment number 2023-0586H. I passed out a copy of that to everybody this morning.
Is there a second?
Second.
Second by Representative Rhodes. Representative Mannion, would you like to speak to your motion on the amendment?
Yes, thank you, Mr. Chair. This amendment came out of subcommittee. We did extensive work on this. I thank the group. What this amendment does is addresses the concerns we had initially with this bill being overly broad and also putting a giant burden on the employer as opposed to the employee. So I think we've addressed those. Essentially, the loophole that we're looking to close, or that the sponsor was looking to close, was registered sex offenders employing minors or supervising minors or having direct one-on-one alone contact or work with a minor. And he mentioned the landscaper scenario. And I believe that this new language addresses that. And in addition, it removes the part where it would require the employer to have a background check for all employees. And that would be overburdened for, fast food restaurants, or if you have 10 separate applicants for a job, for one job, you have to get 10 separate background checks. So it eliminates that portion altogether, which is not part of the current bill, current law.
Representative Prue, would you like to speak to your second? Oh, excuse me, Rhodes.
No, thank you, Mr. Chairman. Our Representative Mannion did a great job.
Further discussion? Representative Bolden. Yes, Representative.
I also want to piggyback on that, we looked it up and child care facilities are already required by law to do background checks. So by eliminating that part of the bill with the amendment, that required background checks, we're not making it so that nobody has to do them. There's already a bunch of businesses that are required by law to do them in other areas of the law. And it seems like those are appropriate. We don't need to do it to the entire state. And also I thought it's worth mentioning that the handouts that we got during the hearing for the specific situations, the guy who was a landscaper, his case was overturned because he was initially convicted of violating the law that requires him to not have a job that involves children, this law, and then the conviction was overturned because the court very specifically said that it didn't make it we had never made it illegal for a registered sex offender to hire a minor. And so that's the loophole that the sponsor was originally trying to close. And I think along the way with the changes in the wording in the amendment, we also addressed the conversation about like being an employee, but having authority in the workplace over a minor. And coming back to like the way that the law is structured, it's the responsibility of the offender and not the employer. And it always has been, because it's just too much for employers. Every sex offender knows they're registered and it's their job, and they know that it's their job to make sure that they don't enter certain types of employment, and the agency that manages them would communicate these changes in a lot of them. So I don't know if that's helpful information to anyone, but I think it's a pretty solid amendment, and I know that there's buy-in from everybody who was really gung-ho either way on the bill initially.
That was very helpful. Thank you. I know that there were a couple different factions going into that competing, and I think that they seem to have merged and found a way to do it. Representative Muse.
Just wanted to say that an amendment like this is one of the reasons why the legislature occasionally works. We actually passed a very similar bill in the House last year, HB 408, that had some problems. And I think we kind of knew it had some problems when we sent it over to the Senate. And the Senate thought it had so many problems that they sent it to interim study, where it was never actually interim studied. So addressing some of the issues like the background check issue, addressing the broadness of the bill that was probably problematic in HB 408 is a good thing. I think it's important that we put a pretty bright line between people who are child sex offenders and children. And what the bill and what this amendment do is they do that. The last thing I wanted to point out in the spirit of maybe having a little fun with a very serious bill is this amendment may be putting the single longest sentence in New Hampshire statute into law. So if you actually do a word count on that long sentence, it's 141 words. Which is somebody who's I'm a big advocate of plain language. So it bothers me, but trying to dissect it and put it back together in a way that addresses that issue, I think would cause more problems than it solves. So congratulations maybe on having done something that no one else has done with this amendment.
Has anyone called Guinness to see if... Now I want to pass it just because of that. Any other discussion? Representative Sytek.
The problem it's fine, it's great, but problem that I have, and it's one we should think about, is a sex offender, does this person wear the mark of Cain? If he opens he did this when he's 26 years old and opens a landscape business when he's 56, does he carry that mark forever? And I just, it's not enough to sink the ship, but I don't like it.
I think that particular aspect is actually important, but I think it's addressed in another statute as far as how long they have to be a sex offender itself. Okay. I think that's where we should, if that needs fixing, that's where it would be done. Who had their hand up? Representative Murray.
I was just hoping to get some clarification on, does this amendment cover all kinds of sexual offenders? Just because I do agree with the point brought up by my colleague, Representative Sytek. You know, you can get on the sex offender list for, you know, peeing outside or being on the beach topless, or you know, there are even cases of minors getting charged as sexual offenders just for like having been undressed around other minors. And there are severe issues with our sexual offender registry list and how it affects people for the rest of their lives. And yeah, I'm just concerned about how this could make it harder for someone who may not even have a victim to get a job.
I'll let the sponsor, or I'll let Representative Mannion address that. I would just, again, what I said to Representative Sytek, I think that's a valid point, and it's one that if a representative has concerns about, then we would look at, or they should look at the statute that classifies sex offenders and for how long and such. This bill just discusses with someone who's already been put in that bucket, whether they belong there or not. So I don't think that this bill addresses the underlying whole concept of who is a sex offender and how long they have to be registered. I think that needs to be done in another bill. Representative Bolden seems to want to say something.
I can address that. We talked about that in the subcommittee, and specifically we talked about it with the representative from the Sex Offender Registry Department here. It says the existing law, if you look at the amendment, you know, existing law is in regular font for the new people. And it says a person is guilty of a Class A felony if, this is line 8 on the first page, having been convicted in this or any other jurisdiction of a felonious offense involving child sex abuse images, or of a felonious physical assault on a minor, or of any sexual assault. And so there's a lot of weird and potentially dumb reasons to end up on the sex offender registry. Sure. This does not apply to everyone. It applies to people who have violated in certain ways. And obviously it's broad because we can't go updating this every time we add a delete or crime, you know.
Thank you, Representative Bolden, for once again pointing out the obvious that's written in the bill in front of us. I don't know what we would do without you today. Representative Mannion.
Thank you, Mr. Chair. And just quickly, that language is current language. So
Yeah.
this bill only addresses the who and what, not the actual underlying offenses. So that language is in the bill, I mean, in the law as it is currently, and that wasn't addressed at all.
Okay, at this point, I'm going to ask the clerk to call the roll on the amendment. This is to adopt the amendment.
Vice Chair Rhodes,
Yes.
Representative Pratt,
Yes.
Representative Sytek, Representative Prue,
Yes.
Representative Janvrin,
Yes.
Representative Mannion,
Yes.
Representative Reed,
Yes.
Representative Stone,
Yes.
Representative Tenzar,
Yes.
Representative Gathright, Representative Muse,
Yes.
Representative Bolden,
Yes.
Representative Bradley,
Yes.
Representative Murphy,
Yes.
Representative Newman,
Yes.
the clerk votes yes. Representative Newell,
Yes.
Representative Howard,
Yes.
Representative Vogt,
Yes.
Chairman Roy.
Chair votes yes.
Motion is unanimous.
The amendment is adopted. Representative Mannion, would you like to make another motion?
Yes, thank you, Mr. Chair. I make a motion that we ought to pass House Bill 107 as amended.
Second.
Seconded by Representative Rhodes. Representative, would you like to briefly speak to this one more time?
Yes, as I said, I think this amended bill now addresses all of the concerns and issues we had with the overly broad initial bill. It was worked on by both the sponsor and a representative who opposed the language. They worked on it together. I think it's a great bill put together, and even though it has the longest sentence ever in a bill.
Yeah, as I said, I want to pass it just because of that now. Any other further discussion? I think Representative Bolden, one more time.
Just one more comment that the person who wrote the opinion that overturned that conviction is Representative Bob Lynn. And he agreed. So when I'm saying the person who wrote the opinion, I'm saying the person who overturned that conviction, saying that our laws were insufficient, is a current rep, and he's the one who came in here and was saying he had concerns about the way the bill was written, and he signed off on the amended version.
Thank you. And for representatives who don't know, Representative Bob Lynn was the former Chief Justice of the New Hampshire Supreme Court. Yeah, until we forced him out with a law that said he was too old. But he is an excellent source of information. So, having said that, did you have some? Oh, Representative Sitek.
I'm not convinced that this, that the sex offender ever expires, but it's not enough to stop this bill or to ask for a carve out for this. So I just want to jump up and down, and that's enough.
Thank you. We appreciate that. And I agree that the sex offender registry probably does need a lot of work. And if anybody wants to sponsor legislation for next year, let's talk about it. Did you have something you want to say? No. With that, I'll ask clerk to call the roll. Ought to pass as amended.
Vice Chair Rhodes,
Yes.
Representative Pratt,
Yes.
Representative Sitek, Representative Prue,
Yes.
Representative Janvin,
Yes.
Representative Mannion,
Yes.
Representative Reed,
Yes.
Representative Stone,
Yes.
Representative Tenzar,
Yes.
Representative Gathright, Representative Muse,
Yes.
Representative Bolden,
Yes.
Representative Bradley,
Yes.
Representative Murphy,
Yes.
Representative Newman. The clerk votes.
Yes.
The clerk votes yes. Representative Newell,
Yes.
Representative Howard,
Yes.
Representative Vogt,
Yes.
Chairman Roy.
Chair votes yes.
Motion is unanimous.
The bill passes unanimously. And Representative Mannion, you'll be doing the majority report. Representative Rhodes is going to tell everybody what we have before we leave. I'm going to close the executive session. And you're going to tell everybody about the reports. Just before, real quickly, I want to congratulate everybody on the great job we did yesterday as a committee. Even the ones of us who are against each other, we gave dignified professional debates. And even if you lost, the committee won because it was us against each other. So there's upsides everywhere to that. And it's been great working with you guys for the first half. We're going to be taking a break after this, 1-2 weeks, I don't know, until I get something from the Senate. So we'll be recessing at the call of the chair. So whenever I get something, I'll let you guys know when we need to be back. One more item. I'm working out a day to visit the court, and I sent that out to everybody where we can go over there, and they're going to serve us sandwiches or something, and the judge is going to talk to us, and I think it should be informative.
Did you resolve all of the, whether it's on consent or not? This last one, I don't know whether you said anything about it.
It's unanimous. So does anyone object to consent on the
No,
last one? No.
I have no objection to consent.
Oh, I don't hear any. Okay, so. All right, so Representative Rhodes is going to tell you if you have a report due for today.
Well, thank you, Mr. Chairman. Okay, so going down the list, House Bill 287, Representative Reed, that was on consent 20-0. Representative Roy, House Bill 397 was 14-6. Representative Stone, you owe a minority report for ITL. Representative Tenzar, House Bill 305, which was ITL, also was 20-0. And so everybody's aware we did withdraw the motion for the ought to pass amendment for House Bill 512. In Representative Mannion, you will owe for House Bill 107. Again, it was 20-0 on consent.
I need those reports by the end of the weekend, please, because next week is the deadline, so I don't want the clerk chasing me down. Yeah, that's next Friday, isn't it? Thursday, yeah. So I need them by the end of the weekend, please. And with that, I'll see you.